Good evening, everyone. I'd like to call this Board of Supervisor meeting to order. The date is September 21st. The time is 6:33. I'm going to ask everyone to please stand. I'm going to ask Deputy Grogan to lead us in the Pledge of Allegiance, and then please remain standing. We're going to have a moment of silence for Community Services Agency employee Christy Costa, who passed away, and then we will have an invocation by Marvin Jacobo from the City Ministry Network.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord, in the middle of the business that you have for us this evening, it is only right and it is good to stop and consider Christy Costa, a community service who loved our community and gave so much of her best time and energy that our community, our county, would be a good place to grow up and to grow old in. And even in the midst of her passing, and taking a few seconds really to remember her, I pray that we would be men and women who are grateful to those who lead us even now and are still with us on the planet. All authority is yours, but you've given authority to leaders to protect and to guide us. And tonight, we ask that you would give all our leaders, those on the dais and those in the back and those in the audience, give all of us leaders wisdom, discernment, strength, and resolve beyond our own experiences. Keep our leaders healthy and safe and rested so that they can continue to guide us through this continuing troubling time. That our government leaders give them wisdom about what needs to be done to continue to control the virus, stabilize our community, and move us into a prosperous next season of our community. Give them wisdom to make the decisions that need to be made regarding resources and funds. Our civic leaders, give them inspiration and courage, joy and strength to meet the needs of their communities. Because, Lord, for our county to be a good place to grow up and to grow old in, it's all of our responsibilities. It's not just these men here in their suits and ties, but it's all of us. And help us, Lord, as leaders to display courage and hope, generosity and kindness with the way that we honor others, inspire those around us. And finally, we take to you and celebrate Hispanic Heritage Month. We stop to reflect on the men and women of Latino heritage who gave their lives, their best time and energy, their families, so that everyone in this community would have an equal opportunity to all the possibilities and the promises that come with being an American. And we celebrate them. We celebrate everyone from every background. But for this special moment, we thank you for those Latinos, those Hispanics, because, Lord, they're amazing people. Amen. Thanks, you guys.
Thank you, Marvin. As always, beautiful. And Marvin has always been really good about getting our invocation set up every week for the last couple of years, so appreciate that, Marvin. And thank you, Deputy Grogan, for leading us in the pledge. Okay, now we're going to move on to item number 5. It's a presentation proclaiming September 15th through October 15th, 2021 as Hispanic American Heritage Month in Stanislaus County. And Yamilet, I saw Yamilet. Yamilet Valladolid will be presenting. Are you going to say a few words first, or am I coming down?
Yes, actually.
Okay.
I'll say a few
Yeah.
words with Aaron.
Aaron Aguiano and Michael Garcia will be with you.
Thank you, Chair. Thank you, Board of Supervisors, for the proclamation that you are doing today for celebrating National Hispanic Heritage Month. And I'm going to cede the mic to Aaron again, who has a few words. He's with the Latino Community Roundtable also.
Thank you. Honorable Board of Supervisors of Stanislaus County, thanks for the recognition given to our Hispanic community by way of your proclamation of Hispanic American Heritage Month today. Diversity is good. The more people from different backgrounds at the table, the more ideas to deal with issues at hand. We celebrate our culture and our hardworking people in our communities. We thank you. We thank our essential workers during this pandemic. They have carried a pretty heavy load, including their families at home that also got the virus transmitted to them. We Hispanics are about 47% of our county's population, and we want assurance that we are represented, that our needs are being always considered before this policy-making body. The politics is not personal, and the policy is equitable. How can that be done? Working together with love and respect for one another. Look, after all said and done, we all want the best for our communities and that our county continues to thrive in the Central Valley to meet the needs of our folks. Thank you. Sorry.
Thank you. And it's Johnny Garcia. I apologize. I don't know.
That's right. So on behalf of the Central Valley Hispanic Chamber of Commerce, I would like to thank you guys for this proclamation. And Aaron said most of everything, so he really can't add much to that, but just thank you. And on behalf of the small businesses here in our county and the big businesses that have employees that are Latinos or business owners that are Latinos, we thank you for this.
Okay. I have to tell you that this is pretty exciting. I'm sorry about that. No, it doesn't matter. It doesn't matter. So I just grabbed a couple statistics, and Aaron, if you want to stand over here, because I know that camera is probably the one that's on. But Hispanics account for nearly 1 in 5 people in the United States. It's much higher here in the Central Valley, and it's more Mexican descent than it is from Hispanic descent, more so. But if you don't know why they picked the middle of the month, it's pretty neat. September 15 marks the independence anniversary of 5 countries: Costa Rica, Nicaragua, El Salvador, Honduras, and Guatemala. And then Mexico's Independence Day is September 16th, and Chile's is on September 18th. So it works in just perfect. We're very proud, and I always talk about immigrants, because when we do this, I think about what makes our country great, what has made our country great, the hard work of immigrants coming in, understanding that there's a chance to better yourself. And I know that you guys have said this 100 times. My dad's an immigrant from Italy, and he ran the same gamut. But as a farmer, obviously a lot of the folks that work for us are Latino, of mostly Mexican descent, from the Guadalajara area, and they've made the success. I just look at our ranch, and it's not possible to do it without these people. And I can think back to all these families that are so important to me, and so anyways, this is just a great day for us. The proclamation that we have, and I'm not a very good reader because I always say I'm too vain, but whereas the National Council of Hispanic Employment Program Managers announced that 2021 Hispanic Heritage Month observance theme is Esperanza, a celebration of the Hispanic heritage of hope. The theme invites us to celebrate Hispanic heritage and to reflect on how great our tomorrow can be if we hold on to our resilience and hope. It encourages us to reflect on all of the contributions Hispanics have made in the past and will continue to make into the future. So again, on behalf of the board, we are very proud to observe Hispanic Heritage Month from September 15th to October 15th. And thank you so much for coming in. We're going to take a quick picture.
Yeah, absolutely.
So Yamilet has the most infectious smile, and you can't even see it with the mask on, but she always makes me happy, for sure. Going to move on to item 6. It's an update related to the 2019 novel coronavirus COVID-19 emergency essential services. I'm going to turn it over to CEO Hayes to start.
Yeah, and I just want to welcome everybody to tonight's presentation. We do try to provide an update on our COVID-19 emergency response to the community on the front end of each board meeting. And just as a matter of process, we do have public comment following this. So what we try to do is capture some of the public comments in future presentations. So I think tonight you'll see some of the presentation is geared towards some of the prior public comment that we had at the last board meeting. And I also want to just thank and recognize Gino Patrizio, our Chief Executive Officer of local Sutter Memorial Hospital, for being here with us this evening. He's been a key instrumental partner with us throughout this emergency response, and we appreciate him being here with us to lend a little insight at some point should he choose to do that. So I'm going to go ahead and turn it over to the team.
Good evening. I'm Marianne Lilly, the Director of the Health Services Agency, and I'm going to start by just making a few remarks before turning it to Dr. Wei-Shen-Payan. I wanted to go ahead and give you a little bit of an update on the emergency response and the scope of what we're doing. I'm not going to walk through all of these, but I do want you to know that there is continued work going on in all of these areas. I'll just call out a couple of things with case investigation and the contact tracing. When we look back at the most recent 30 days and look back the 30 days prior, the cases have almost doubled. And so the work, the reaching out to those individuals, trying to make sure that they have the information they need and that they're doing what they can, isolating so that we don't have further spread. We continue to do that, and it is a challenge to continue to scale up and down as the pandemic trends move forward. And also, what we're having to do is not just impacting the Health Services Agency, and I want to be sure that you all know that there are other county departments that are helping us. Including but not limited to the Community Services Agency, who continues to provide care and shelter for those that need additional supports in order to isolate or quarantine. The couple other just, I think, worthy of mention, the Medical Health Operational Area Coordinator. It's a role that is shared between the Public Health Officer and the EMS agency, and it really has to do a lot with resource requests when needed. In the beginning, it was all about PPE. As of late, it's been more about staffing to handle the surge. Maybe involve ventilators from time to time. It is still PPE, but that just so you know that work continues, and it's something that's done in coordination with the region and with the state if we can't fulfill the needs locally. Through this whole list. And I'm sure I've left some things off, but I want you to know, and the public to know, that it's not static. You'd think that at this point, well, all of that would be in place, but it still continues to change. The circumstances change. The supply. Sometimes there's shortage. There are different guidance, different needs schools are in, different information with regard to vaccine, different planning. You're hearing a lot about that in the news. So it is an ongoing effort, and I want you to feel assured that we continue to take the steps necessary in trying to mitigate the situation. The The next slide you've seen before, but just to let you know that the testing sites that we've arranged with the state are still in place. As you know from several weeks back, we worked with them to, bless you, to expand capacity because we really weren't keeping up as the cases were rising. We got to the point where those appointments were really filling. Now they're back to the point where there is availability on a same-day basis at these sites. So I wanted you to know that that's the current status. And then you've seen this too. This is the just trying to encourage continued effort here to encourage vaccination of those that haven't yet been vaccinated. What you're seeing on the screen is a snapshot of the state My Turn website. It continues to evolve as vaccine, the situation evolves. They've added, that additional dose. You heard about that before in terms of the immunocompromised. So just encourage anyone who has any questions to reach out. Go to the My Turn website to schedule. Give us a call. Give the My Turn phone number a call if online accessibility is an issue. And with that, I'm going to go ahead and turn the presentation to Dr. Weishampayam.
All right, good evening, everyone. I'm going to start with vaccination and giving us some vaccination numbers. So there's been a lot of data cleanup in the databases at the state level. There was some lack of matching, which we knew about, between vaccines that were, say, given by public health that go into one registry and, say, vaccines given by CVS, which go into a different registry. So those are matched up. And so I think what you can see is that our percent of people who are partially vaccinated in the blue is decreasing now that there's been more matching. And then you can see for our 12 and older, 52.9% was the most recent number we had. So this continues to evolve, and I think the cleanup is now complete, at least from what I've heard. So still moving forward, still have a great many people left to vaccinate. Here you see our vaccine doses administered by day in the county, and we had a peak average of 4,500 a day for a little while. We had a dip, it was decreasing. We had a dip around the 4th of July, a little bit of a dip around Labor Day, but been giving somewhere between 12 to 1,500 doses per day for the last month or so. So what's really in the news right now is booster doses, and booster doses as opposed to that third dose. We've discussed this before. This is for people who developed immunity, but there is decrease over time. So we're going to talk a little bit about that. So antibodies, the vaccine or previous infection gives antibodies, but it really doesn't, it's not defined how many antibodies we need. What's the level we need to protect us? That's why, as I've spoken in the last couple meetings, there isn't an approved test to determine that because nobody has set a cutoff for antibodies. You can't do a test right now and say, okay, you're protected. It might not be enough antibodies. It might. That hasn't been defined yet. Antibodies always decrease for the first 6 to 12 months after any infection or vaccine. We know that they're highest when you've just had the infection and your body's just making antibodies. They decrease for about 6 to 12 months and stabilize at a level. So this is expected that they would have decreased over the first 6 months after vaccination. Do we have enough? That's still the question. And that's the booster question that's being asked right now. Do we need a booster dose? Do we need more antibodies to be produced? We have seen a small decrease in protection against symptomatic disease. Protection against hospitalization deaths, as I presented earlier, have been very protective. We haven't seen a decrease at all. But this decrease in protection against symptomatic disease, is this because our antibody levels have declined? Because they do that. Is this because of the Delta variant? Is this a combination of the two? Those are questions that are still outstanding, I have to say. A booster dose does clearly increase the level of antibodies, and that's been shown. Many vaccines need a dose a little bit later to really stimulate that long-lasting immunity, so it actually makes sense that we would need another dose at about 6 months. So those are the questions that are now before the FDA and the CDC. So the advisory committee to the FDA met last Friday, and they recommended booster doses. The data are only here for Pfizer right now, so this is only a booster dose for Pfizer for those 65 and older. Others at high risk of severe disease, and it would, the recommendation is 6 months after completion of the primary series. And this was based somewhat on the data that was submitted by Pfizer. So the next step in this is FDA, as of this afternoon, the last I looked, is still not officially authorized. They don't have to follow their advisory committee recommendations. They can do other things. The advisory committee then to the CDC is set to meet Wednesday and Thursday, tomorrow and Thursday, to make recommendations to the CDC. And then CDC will make some recommendations after this meeting of the advisory committee. And then, so that'll be sometime later in the week. And then the Western States Scientific Review Work Group will meet at some time after the advisory committee to review the data. This is a work group that was stood up on the West Coast to review. So it's a long process of review by a lot of experts from around the United States as these recommendations are coming down. So not sure where that's going to land yet. Hopefully by the end of the week we'll have a little more clarity on boosters. As Marianne said, we are actively planning for booster delivery to ensure that we have capacity to ramp up some of this. Definitely pharmacies have some availability, and we'll be looking at how to best serve our communities. So I'm going to move on to some of the school guidance of quarantine. From some previous public comment, there's been a lot of confusion around quarantine. So I would please ask anybody who is confused about it, please go read the guidance. It's on the CDPH website. It's pretty easy to find. The K through 12 guidance, I'm sure you can just Google and get there, but here is the link at the top of this slide. This is guidance for the schools. Each school can implement this differently depending on local factors, the size of the room, whether they have seating charts, like gym, you don't stay in a seat. I mean, it depends on a school, it depends on a facility. Schools are under their individual elected boards, and they may implement each of these things differently. As I keep saying, local public health does not create the guidance and does not oversee school implementation. The role of local public health and the role of the entire team there is to assist the schools in understanding the California Department of Public Health guidance. So if anyone thinks that the school is not following the guidance correctly, they should follow up first with the schools and discuss with the school what your feeling is about the guidance and how you feel it's not being implemented. If you still have questions, you can contact Public Health, and I have a lot of contact information at the end of this presentation. So I'm going to go through, again, masking in sports, because this seems to be another misunderstanding about the guidance. So again, the California Department of Public Health, same website, same guidance. You can see here what it says, number 1 from the guidance, masks are optional outdoors, and K through 12 students are required to wear a mask indoors, except as exempted by the CDPH face mask guidance, so it'll link you to that guidance. Adults in K through 12 school settings are required to mask when sharing indoor spaces with students. This includes at basketball games or any other extracurricular activity. If you're on the K through 12 grounds, you're required by the state guidance to mask indoors. If you look at the guidance and you go to number 16 on the guidance, this addresses sports and other extracurricular activities. You look down in there, this is sports, but also band, choir, other clubs. Masks are required for all persons while playing all indoor sports, unless wearing a mask during play has been determined to pose a choking hazard by a well-recognized authority, such as the American Academy of Pediatrics. You see that footnote there. Number 1, and it's linked in the guidance, and if you go there, here is what the American Academy of Pediatrics says. Face masks should not be worn for competitive cheerleading when tumbling, stunting, or flying and gymnastics while on different apparatuses, because of the theoretical risk that the mask may get caught on objects and become a choking hazard or accidentally impair vision. And then there's wrestling. So during wrestling, contact of face masks could become a choking hazard and is discouraged unless a coach, adult coach, or official is closely monitoring for safety purposes. And then swim, dive, and all water sports, because you can't wear a face mask in the water because they come wet and you can't breathe through them. So I urge everyone to go see the wording from the American Academy of Pediatrics. It's a long document that goes through a lot of the risks and a lot of the the data around this. So I've heard that this is because of the local masking order. Is not the local masking order. Under number 5 says that persons, this is the exemptions, they're not required to make it as it's specifically exempted pursuant to CDPH guidance. So this is in referral to the CDPH guidance for schools, as well as the other exemptions that are listed in the CDPH face mask guidance. So I wanted to be very clear about this. Again, this is not a local rule. Here is from the California Interscholastic Federation, and the link is located there. If you could see in the red box for sports, and they repeat the American Academy of Pediatrics, and they repeat the state guidance you can see here. If there is not masks being worn during this sports activity, you can see that you have two options. You can either do these outside. I don't know many wrestling matches outside, or water polo, or you have to participate in a testing program, all people, including those who are fully vaccinated. So those are the rules around masking and sports for our K through 12. As we go to school reopening, other questions that have come up, there were statements about the local public health determined who went to school and who did not. So again, the California Department of Public Health guidance for K through 12 schools has been followed for the reopening of schools. The guidance was from last year. It's been updated for this year, but last year anyone can look. Stanislaus County did not make any of these determinations. We did not inform schools at any time to allow younger grades and not older grades based on any local decisions. That was all just through the California Department of Public Health state guidance that we were following and making recommendations to schools. Someone talked about something in the throat. As we look at this, there is some biologic reason for kids here, the younger kids, to be less likely to be infected. I talked about this, I don't know, a year ago at a board meeting. I've shown this picture before too. So this is the angiotensin converting enzyme, or ACE2 receptor. You can see the coronavirus on the right with the spike proteins. Those are the spike proteins we're always talking about. The little turquoise on the end is where they bind to the receptor. That's called the receptor binding domain. And then you can see the little yellow and red coming out of the cell. That is the ACE2 receptor, and that is where the coronavirus spike protein binds. And that receptor opens up the cell. The virus enters the cell. If you recall your virus, how they work, they go into the cell. They use your cell's mechanism to replicate themselves. So they're using your normal body's, RNA, DNA to RNA, RNA to proteins. This is how viruses replicate. They use your body's replication process in the cells. And they make a whole bunch of viruses, and they rupture out of the cells, and they go infect new cells. This is how viruses work. So this virus, SARS-CoV-2, which is the virus causing COVID-19, binds to this ACE2 receptor. Young children have fewer of these receptors in their nose, and it's postulated as part of the reason that children are less likely to get infected once they're exposed. But this wasn't any reason why anyone said kids go to school or don't go to school. That was based on guidance that was created by the California Department of Public Health, and it was, I can't speak to what it was based on because I'm not part of the forming of those rules. But this is what I think was being alluded to in the last public comment when they were talking about this. So just to clarify this receptor and the information around it. And anyone can just Google ACE2 receptor and coronavirus and children, and you can come up with this information. So we have a lot of information on our website. You've seen the information about testing and how you can sign up for testing and get an appointment and where the sites are. You've seen the vaccine information. I'm going to show you some information from our dashboard and the link for there. All of this information plus much, much more is on our website, schsa.org/coronavirus. It's not that long of a web address, but you can really get to it from many sites. If you go to stancounty.com, the main Stanislaus County web page where you can access this board meeting, for example, and the agenda and what's being talked about, there's a link right on that page, and you can see a picture of it in the top right. The Regular Health Services Agency landing page, schsa.org, right on the front page, there's that link to COVID-19 information that you see to the left. You just click on that and get to the coronavirus page. Or stanemergency.com, you can see their link on the right with their coronavirus, and you can click on there. So there's many ways to get to this page rather than just type in the address. You can type in many Stan County web pages and go there. On there's many ways to get information. If people have questions, please contact us. That's what all this is for. So on this main landing page, you can see right at the top on the right, there is the contact us and a phone number to be called. As you go down the page, you see that coronavirus picture with this. Do you have questions about coronavirus? Contact us, and you could submit an email. We have a newsletter. You can sign up to get information on the newsletter, and that's the picture on the left. And inside that, there's a link right on the front page. And inside there, you can see, do you have a question? Ask Public Health, and you can click right there on the newsletter and submit your question. And these questions are used they're answered in the next week's newsletter. So there's many ways to contact us and get information. So please feel free. We have an entire team of very competent people waiting to answer your questions. So anyone who has questions, please feel free to use all these ways to find it if you can't find the information on our website. I'm going to move into our situation and our data. So here we are with our epi curve that I show each time I'm here. The blue bars are the confirmed or PCR positive. The green are the antigen or the probable tests, primarily the antigen tests. So you can see that our last summer peak, our winter peak, and our this summer, early fall peak. We did get a little bit above last summer's peak. It certainly has been continuing on longer than last summer, but does appear to be decreasing. So we can see our biggest day there was actually August 16 with about 440 cases, followed by August 23. Mondays are always big days because people don't test as much on the weekends. So with 430 or so. So we haven't been up there, and we have been coming down, but it has been slow. As we look at here, our case rate that used to be used to do our blueprint, it's a 7-day average. It's a 7-day lag on those data because you have to wait to get the test results back. And you can see our case rate right now is well above the purple rate at 39.1. We have to get below 10 to drop below purple if we still had the blueprint available. We still kind of use that as reference to see where we are. We peaked out at about 50. 55, I believe it was our peak rate. Then this is our percent positive, again, a 7-day average and a 7-day lag, and we are just below 10% of tests. We were up above 14. So it is coming down. Everything always comes down, what seems like very slowly. And you can see that we're doing nearly 500 tests per day, 500 per 100,000 per day, so that's well over 2,500 tests per day. With about a little under 10% of them being positive. As we look at our hospitalization and our ICU, you can see we peaked pretty high. I'm really kind of surprised because our cases didn't seem to be that high, but our hospitalization certainly went very high. I think we peaked at about 314 COVID in the hospital. Last summer we peaked at about 260, if I remember, and of the winter we peaked about 360. So it was pretty much halfway in between there. Our ICU, we were up at about 75. We've come down just a little bit. So ICUs are still very full, but hospitalizations for COVID are improving. I do know our hospitals are still extremely full with non-COVID, and we will hear about that in just a moment. These are our deaths by week, and you can see, deaths lag quite a bit, and we started seeing quite a few deaths being reported over the last couple weeks, and so peaking about 2 weeks ago so far at about 32 deaths in a week. So we are still seeing significant numbers of people dying from COVID-19. And then lastly, this is from our dashboard, and we have 7 pages just chock full of information. I just urge anybody who is looking for some information about our COVID in our county to go look at our dashboard. And this is on the front page, the landing page of the dashboard. And what we're showing is cases per 100,000 by vaccination status. So the solid blue line is the not fully vaccinated, and the dotted line is the fully vaccinated. So you can see the difference in case rates and the protection of the vaccines here. Again, not 100%, never were 100%, but really good protection. For our hospitalizations by our countywide data, what we see is 83% of the people hospitalized are unvaccinated, and the people dying, 92% of them are unvaccinated. And so I am going to ask Mr. Gino Patrizio from Memorial Medical Center, Chief Executive Officer, to come up and give an update on hospitals.
Good evening. Thank you, Dr. V. Thank you, Marianne. And thank you for leaving that last slide up, because it is quite compelling. To start with the status of things, and I think you got a pretty good picture of it. The last 5 weeks have been real challenging for all the community hospitals, and I will tell you that it's a privilege to stand here and address you all. But I will also tell you that I speak at least weekly, and sometimes more often than that, with my colleagues in hospital leadership from Doctors Medical Center, from the Kaiser entities, from Oak Valley, from all of our healthcare leaders in our community, and we all have had the same experience for about the last 5 weeks. The last 5 weeks, our COVID census has been between about 90 to about 120, and it's waxed and waned a little bit. And there are a couple of times where we thought it was going to be coming down, and it shot back up. Most recently, this last week, where we had dropped as low as 90, coming down from 110, and then we shot back right up to about 110. And of course, over the weekend now, we've seen a little bit of a recession in COVID numbers, and I'm very happy to report that. But against the backdrop of that, our overall hospital census has been unseasonably high as well. It's been in the 325 to 350 range at midnight, which means we're running about 350, 370 patients during the day, all day long. And although we're licensed at 419 because we have some aged parts of the organization where we have some semi-private rooms that with modern hospital equipment really can't be semi-private anymore, we really operate about 370 beds. So when we're running at 360, 370, every physical bed is full in the hospital. And the same goes for my counterparts at our other community hospitals. They're running well above their historical census for this time of year. If there's any good news, and by the way, I should mention too, our ERs, and again, this has also been the experience across our communities, is that our ERs are running 20 to 25% higher volume than what would be normal for this time of year. And that's very, very taxing on the staff. It's very taxing on the community. I'm sure there are people in the audience that are dissatisfied with their ER wait times, either at Memorial Medical Center or at any of our other county facilities, because our volume is so high. Our ERs are physically at capacity from very early in the day all the way through. So it's taxing. Now, if there's any good news, today we're seeing a little bit of a recession. It's a little too early for us to declare victory, obviously, but we're seeing a little bit of a recession. Our COVID numbers, as of when I left this afternoon, we were at 88 COVID inpatients, and about 22 of those were in the ICU. Sorry to say the majority of those in the ICU are vented. It means they're requiring mechanical ventilation to sustain their breathing. And our hospital census was a little above 280, so it's a little closer to where we should be this time of year. So we're seeing a little bit of a reprieve. So to talk about our experience, and this is our third surge. You saw the graphs. Everybody saw the graphs. We had 2 prior surges. The difference between this surge as compared to the first 2 really has been the length of it. And the first 2 surges, we hit a peak pretty steeply and immediately came down. Now, of course, you don't know where the peak is until you start coming down off it. But when we look back historically, we hit a peak in a day and then started back down. We've maintained this 90 to 120 COVID census level we're in our 5th week of it now. So it's been a little more sustained surge, and we do believe that's due to the virility and the contagiousness of the Delta variant. That's really what's different. So everybody's impacted, but the important thing, and I was prepared to talk about this, but Dr. V talked about it very eloquently. There is an incredibly large disproportionate impact of the Delta variant on the unvaccinated versus the vaccinated. Our county data right there, which is right in front of you all, shows that at 83%, that's somewhere between 5 and 6 to 1. For every 5 or 6 unvaccinated patients in the hospital, there's 1 vaccinated patient that ended up in the hospital. And our deaths, this is 23 to 1. Our experience in the hospital for deaths is about 20 to 1. So out of every 20 people that we're losing from COVID-19 in this third surge, 19 of them are unvaccinated. And I will add that you know, they always express regret, and of course, by then the horses are out of the barn and it's a little too late. But our data, whether it's our Memorial Medical Center data or our overall hospital data, it's consistent, it dovetails with one another, which tells us what we already know, which is that vaccination is going to be our #1 protective measure. And that's not a genoism, that's, the data is right in front of us. It's really, really hard to deny that data. So when we talk vaccinations, what we also saw is from Dr. V's data is a real flattening of our vaccination line, right? And if you look at the data that I get from the county's website, what we're seeing is over the last 3 or 4 weeks, even in the midst of this surge, is not a lot of new vaccinations. So the county has published data that shows people that are fully vaccinated with both doses, and people that are partially vaccinated with 1. And over the last month, and I've been watching this very closely with a lot of interest, what we see is the total number, the aggregate number is not really going up. And if it's going up very, very slightly. What we're seeing is people are completing their vaccination course. About a month ago, it was 47% fully vaccinated and I think 16% partially vaccinated. Now we're sitting at 51% fully vaccinated and 12% partially vaccinated. So people that are starting their vaccination regimens are finishing them, but we're not seeing a lot, at least statistically, of net new vaccinations, and that's a little troubling. So where am I going with all this? It's all interesting data, but where am I going with all this? And that's the whole point of my presence here tonight is to just suggest that the question that we should start asking ourselves as leaders, and that includes all leaders in our community, is what can we do to reach the communities and populations that have heretofore been unresponsive to the messaging that we've engaged in around COVID-19, around protective behaviors, around vaccinations. You know, the last several weeks have been super challenging for us in the healthcare business, which is why I get to this place and why I suggest that this is a conversation we need to be having with ourselves and with each other. And why now? Well, you know, we certainly have surge plans at the hospital. So when the hospitals are really, really full, we have levers we can pull to ensure that we're not saying no to anybody who needs urgent care. And I'm very proud of the fact that we haven't. And I know my colleagues from our other facilities here in the county would say the exact same thing. But there has been an impact, right? We have had, for the last 5 weeks, we've done a minimal amount of elective surgery. I know that many of our other facilities are in the same boat, which means people that need medical interventions that may not be an emergency, but is significantly affecting the quality of their life, quality of their family's life, perhaps their ability to earn income, perhaps their ability to care for their family. That care is being delayed, and it's being delayed substantially. So when I start thinking about what we should be doing now, what I'm really thinking about is this winter. And let me be clear, I'm not predicting a winter surge. I wouldn't necessarily have predicted a third surge. So I'm not predicting a winter surge, but it's my job to make sure that we're prepared for a winter surge if there's a fourth surge this coming December, January. Why? Why is that so important? Because winter is always a little bit more complicated in the hospital world, right? Our volumes are always a little bit higher because we have you know, it's flu season, so we have flu, we have pneumonia, we have RSV, we have COPD exacerbations because the air is cold and dry. Anybody that's fragile, they tend to exacerbate. And I could go on and on and on of why it's much busier in the hospital in the winter, and I think everybody kind of gets that. A fourth COVID surge or another winter COVID surge would certainly complicate that even more, and we would likely find ourselves back in the situation that we've been in for the last 4 or 5 weeks, possibly even worse. So part of the way I interpret my job as the leader of MMC is part of preparing for the winter for me is to help find ways to reduce the spread of COVID-19 so that it's less impactful if there is a surge this winter, and maybe even prevent a surge. So the good news is we know what behaviors reduce spread. We know vaccinations do. The data is really, really hard to deny. We know that good hand hygiene is a great weapon. We know that masking is universally recognized at least by all the medical authorities, as a preventative measure. We know that there are behaviors that people should engage in if they're symptomatic, right? That means you should, if you're symptomatic, you should stay home, don't go to work, don't go socialize, seek medical attention, go get tested, isolate yourself. So that brings me back to the point that I really wanted to raise, which is I think we should be asking ourselves, what can we do? What can we do to reach people that have historically been, or at least heretofore been, somewhat resistant to the messaging around COVID-19? And that's my purpose for being here tonight. And I'm happy to make some suggestions or talk or allow you to take that and run with it. And I'm happy to be involved in any way you think I might be helpful.
That is fantastic. So I think for the sake of time, we're going to do idea sharing offline, if that's okay.
Absolutely.
And Gino, I got to tell you, thank you very much for taking the time to come in. I know that when Dr. Mimi makes decision from day one, we've always been talking about making sure the hospital beds, the capacity is not overrun, or it's time to do mitigation measures. And I think, again, we hit another one of those moments that was touch and go.
Sure.
I appreciate just the conversation. I know you talk weekly with our folks, but we appreciate it.
It's my pleasure. And I will say this in parting, I get to stand here and talk and address you all, but I do so standing in the shadow of the people that I have the privilege of supporting, that literally put their lives on the line every day to take care of our community. Some of them are here, I recognize them. So they're the heroes. I'm just the mouthpiece and the guy that's designed to clear the runway so that they can fly. But thank you very much for your time. I really appreciate it very much. Thanks.
Thank you.
Thank you.
Okay. Any questions? Was that the end?
Yeah.
Okay. Any questions, Dr. B, comments? Seeing none. Okay. Thank you very much for that
Thanks, guys.
informative update. Appreciate it. So now we're going to move on to the public comment period. It's an opportunity to speak on anything that is not on today's posted agenda. The board can't take any actions on anything other than a few comments. We're going to limit comments to 5 minutes or less. And I do have speaker cards. If you don't have to fill out a speaker card, but if you do, it expedites it. I have 2 speaker cards. And then anyone else who wants to speak, as soon as you see the 2 speakers called, please start lining up in the walkway right here. First one up is Steve Morrow, followed by Julie Key.
Okay. Thank you, Mr. Chairman, fellow supervisors, Mr. Hayes and Mr. Bose. The timing on tonight's meeting on the county budget is ironic since our Congress in Washington is once again wrestling with debt ceilings, budget matters, and pointing fingers at each other. We can only hope that someday the members of Congress will realize that they can get a lot more accomplished by shaking hands with each other rather than pointing fingers at one another. So subsequently, many people are frustrated at their government. They don't want to pay taxes, so the easy solution in budget is to cut or reduce this, cut or reduce that. I dislike paying taxes as much as any person in this chamber tonight. But if we want a planning department that helps with obtaining permits so that we can expand our homes, if we want a clerk's office that issues marriage licenses and maintains the community vital records, if we want a district attorney's office that prosecutes people who don't obey the law, and if we want a sheriff's deputy or other first responder to respond whenever we need them 24/7, all of this costs money. And surprise, there is no free lunch in life. The money for all of this has to come from someplace. It comes from the taxes and fees that we as a community pay. So tonight, we ask that you, our elected supervisors, carefully consider the many needs of our community and adopt a fair and reasonable budget for the benefit of us all. Mr. Chairman and supervisors, thank you for the opportunity to speak this evening.
Thank you very much, Steve. Next up, Julie Key. And then anyone else that wants to speak during public comment, line up, please.
Hi,
Hi.
my name is Julie Key, and I live in the 4th District, which is Mr. Gruhl's. I am a licensed mental health clinician with BHRS and a member of Local 521. I work with child and adolescent trauma victims at the care center, and I do my job well. I am speaking out today regarding the shot mandate and weekly testing. Many employees, including myself, are requesting exemptions, and because of this, we are being treated like we have leprosy. We are being segregated, and I myself have been taken off-site and no longer allowed to serve my at-risk families face-to-face. I am also being required to utilize vacation or unpaid time for any downtime that may occur throughout my work week. Even during quarantine, this was not a requirement. This is retaliation and discrimination. This inability to provide face-to-face services is unfair to our community and clients who thrive in face-to-face mental health services. This limits my ability to utilize much-needed trauma interventions, especially among younger youth. The families I work with have gone through tremendous trauma, and having a safe place to process their trauma is crucial to care. This form of discrimination punishes the youth and families that I work with. Stanislaus County has stated that employees may request an exemption due to religious beliefs or medical condition. However, on August 30th, a county memo was sent to employees stating exemptions may be requested as long as they do not conflict with the order. This is confusing and frankly against our civil and constitutional rights. Mandates and orders are not law, nor do they ever supersede our rights. It does not matter who the orders or mandates came from. They do not have the authority to disregard the Constitution, our civil rights, or the Nuremberg Code. I will not turn my back on my faith, and I stand firm in my beliefs. You are public servants and work for we the people. I am asking that you examine the tactics being used by BHRS to discriminate and use retaliation, not only against myself, but also these families that are being impacted and the multidisciplinary team I work with. I pray that you will consider the implications of these decisions. Thank you.
Thank you, Julie. Yeah, come on forward and please state your name. That's okay.
My name is Elizabeth Vega, and I'm originally from beautiful island of Philippines. And I'm here with my 19 years old. This is my first time. And I pray to the Lord that you hear us. I'm here because I love this country. I love the hardworking people. And seeing what's happening in this country, you see, my country is right now suffering because of a leader who is dictator. He called unvaccinated people walking dead. And he also proudly said that, well, for all I know, you all can die. I'm not an anti-vaxxer. I am not anti-vaccine. I just want to use the freedom that the Lord has given me. And before anything else, I just want to share something. I just would like to respond
Please
to the...
just keep addressing us.
Yes, sir.
Thank you.
Well, it's according to the things that he mentioned about the death and this. We need to understand what these deaths are all about. Majority of them, according to the records, are elderly people. Now, first and foremost, sir, the Lord has given us wisdom, knowledge, understanding to do what is right and pleasing in the eyes of the Lord. And I am here not to, I just want to encourage, please, vaccinated and unvaccinated brothers and sisters, let us serve one another in love, not hatred, not confusion. This division that COVID created, actually the problem here is not COVID. The problem here are the people behind this. These people are the ones who created division using mongering fear. This saved me. I never planted in my life. I never knew anything until the Lord showed me what I needed to do, because I used the wisdom, knowledge, and an understanding that He blessed and gifted me. Brothers and sisters, we cannot live in fear and we cannot depend on doctors. God has given us the opportunity. All the blessings, these wonderful blessings that God has given us is being lost. I am here and my beloved son to request, please let us replace faith over fear, confusion, and division, which is not from the Lord. And once again, I just would like to give my beloved son, this is his first time, he's 19-year-old, and I pray for all vaccinated and unvaccinated brothers and sisters every day, and for all of you, because we need to serve one another in love, not division. Thank you very much, and God bless you all.
Thank you, Elizabeth, for coming in. Come on. Please state your name.
Hello, I'm Corinne Whitlow. I'm
Hey,
up
Corinne.
here fairly spontaneously as usual. But I just kind of wanted to touch base on some things that were mentioned in the COVID-19 update, since this seems to be my only avenue to actually get any type of response to any questions because the website doesn't work. Okay, so basically I look at this and I see everything kind of that we present to the community lacks education unless it's in regards to the amount of people who have been vaccinated and the amount of people who die who aren't vaccinated. Otherwise, you don't see education provided for our community. Even in the scope of things that the CDPH is working on, you didn't see education in there. I know it wasn't a compiled list, but that just tells you it's not on the top of their priority to actually educate our community. And I'm talking about education on the vaccine. You want people to get vaccinated? Give them education. Let them read it and decide for themselves this is what they want to do. It's not going to work to tell people what to do because it's the right thing or it's free. My other concern is the CEO up here talking, and I really appreciate that he wants to come up here and kind of look in the future. I'm telling you right now, there is going to be a 4th wave of COVID and a 5th wave, and we're going to do this for a while. Hopefully each wave we learn something. Doesn't feel like we've learned much in the last 3, but hopefully each time we can learn something and kind of hit it differently. My concern was the it seems like in general the plan is to get people vaccinated. We don't talk a lot about the other things that we can do. Currently in this 4th wave, we are in a staffing crisis. So I don't anticipate a ton of staff coming in the 4th wave, and I don't anticipate vaccinating the unvaccinated staff to save us all from the 4th wave. We need people on the ground. We should have been building a healthcare army instead of building an army to get people vaccinated. That is what we need to do right now. We need to provide education for alternatives in our community. We have a lot of hospitalizations because we don't have a lot of treatments for our people before they come to the hospital. There's lots of education opportunities here that we're really missing for our community. I believe that is the missing key factor here. So if you want to get people vaccinated, we need to educate them. If you want to keep people from dying, we need to educate them. Hopefully people who come up here and have something to say about COVID are willing to listen as well. I feel like that's another key part we're missing here. We're not really, a lot of people aren't working together, some are, but I just really hope that they listen to this and they take this opportunity to hear their community and they hear what's going on. In my opinion, a vaccine isn't going to fix this problem. Connecting with people and really identifying what's going on with these individuals and seeing how we can get them back working and support them while they're working, that's what we need to do. Thank you.
Thank you very much.
Hello, sir, supervisors. Hello, sir, chairman. My name is Savmir. I am here to speak for the unspoken, and I am here to speak for those who cannot speak for themselves, Proverbs 31:8. And from what I've researched, there's a lot of, since the very beginning since COVID started, we've been a little dismissive on the mental health that has risen across the country. And mostly also as well the suicides among teenagers, some of which I also know. Excuse me, sorry. Yes, sir, I'm here to speak for the neglected, and I thank you for having me here. And the response to COVID-19 has made us dismiss of the mental health consequences, and we are focusing more on the vaccine, and when we should also, as well as focus our attention to those who are being isolated, those who do not know how to handle the isolation. And from our previous lockdowns, we have also seen businesses close, and there's also a worry. My father, who is a hardworking man, works night shifts and as well as a business, works about 20 hours a day and sometimes only gets 4 hours to sleep, and is still living paycheck to paycheck. And he's also worried, we are also worried, that these vaccine mandates might cost him his life. If these vaccines are required at work, he might lose his job, and we are praying that does not happen, and we just pray that the council may listen to the people, and as well as it doesn't matter whether you're unvaccinated or vaccinated. We are all Americans, and we all bleed the same blood, sir, and we are just concerned about the leaders who are passing these laws and the consequences that might come with them. So we only ask that the council listens to God and God's people, and we just pray that you will make the wise decisions. And actually, as we entered here, we were surprised to see under God we trust, sir. So I thank you so much for having me, and God bless, sir.
Thank you, Vladimir. Anyone else for public comments? Okay. Seeing no one for public comment, we're going to move on to the consent calendar. I have 2 items we're going to pull. One for comment from the public, B9, and then also D1. Would any board member like to pull any other item? Would anyone in the audience like to comment on any other item? Okay, so what I'm going to do, because I think they're just comments, right? Yours is just a comment. I'm going to take B9 first for the public, and the speaker card is Robin Conley. And B9 is just for the public. It's approval to introduce and waive the reading to adopt an urgency measure, an ordinance reopening Chapter 6-70 of the Stanislaus County Code relating to ambulances. Good evening, Robin.
Good evening. I'm Robin Conley. I'm an RN with 30 years of experience. The last 16 years I've owned Provident Care, which is a home care company. We provide caregivers to seniors at their home. We also have a contract with Memorial Hospital to provide community case management for patients with high rehospitalization rates. And I'm also the owner of a newly formed company called Provident Senior Solutions, and we're looking to provide non-emergency gurney transport. About 6 months ago, the hospital approached me and asked me to try to provide non-emergency gurney transport. The reasons that they had at that time was that with COVID and staff shortages, there's a lack of availability of ambulances for this type of transport. And this lack of availability has been delaying hospital discharges who are greatly impacted by COVID and staff shortages. They also expressed that the cost of these simple transports is very high. And in my research, I found that it was about $600 for a transport from the hospital to any nursing facility in town. The types of patients that we're looking to transport this way are very stable. They don't require medical attention. For medical or comfort reasons, they're not able to sit upright, so a wheelchair transport would not be appropriate for them. And they do not require ambulance-level personnel or equipment. These transports will be scheduled. They're not in response to any sudden medical need. And these patients are usually going home or to a facility or to receive treatment. Based on the request from the hospital and other research that I did with other facilities in town, I went ahead, I set up a corporation, I purchased vans, I've hired staff, and then, and this was all required for the city permitting process. When I submitted my application for a non-emergency gurney transport, I was told that I had to comply with the ordinance 6.70 that you're discussing tonight for ambulances. And the term ambulance, it said in the ordinance, does not apply to persons confined to a wheelchair, but it does apply to vehicles utilized for non-emergency transport of persons confined to gurneys. I was also told to submit an application for non-emergency gurney transport to Mountain Valley EMS. And in reviewing that application, I realized that it would essentially require me to become an ambulance, as it required 24-hour dispatch, medical director, a long list of emergency equipment. So I was excited to see the proposal before the board tonight, but as I read the proposal, I was not certain it addressed the main concerns as written, so that's why I'm here tonight. I want to ensure three things that would be covered in this, and that's one, that non-emergency gurney transport will no longer be considered an ambulance, that we will no longer need to seek a permit from Mountain Valley EMS, and that will be considered a non-emergency transport service that's similar to wheelchair transportation. These things are essential to meeting your stated goals in repealing Chapter 6.70. This will allow non-emergency providers like myself to transport stable, non-emergent patients so that EMS is freed up to use their personnel and equipment on emergency-type patients. This will also release providers from unnecessary ambulance requirements that are very costly. They can then offer these services to patients at a much more affordable out-of-pocket cost. I anticipate that I will probably be able to offer this service for about 50% cheaper than the $600 that is currently being charged. And again, all of these people usually pay out of pocket for this. In your current proposal, you talked about a two-tier system of advanced life support and basic life support. And I believe that a third category of true non-emergency gurney transport is key to relieving pressure on the taxed EMS system currently. Thank you.
Thank you very much, Robin. I'm going to tell you, Richard Murdoch, right there with the badge on, he's going to be the right person to talk to on this. He's our OES director. I guess he's not the director, that's Sheriff Dirksey, but I call you the director. He's in charge. Okay, so then D1, I'm going to turn it over to Supervisor Withrow, who asked.
I think we're just going to have Angela really quick just come and talk a little bit about this. It was just when you see this, it kind of seems confusing. It's like, what's going on? Why are we having to go through all these hoops with the state? And I'd just like you to explain it. You know, we're working so hard on trying to get these sewer lines in these disadvantaged communities. And here we are. It almost seems like the state's got a little roadblock going for us here to get there. So anyway, I thought it'd be great for you just to explain what this is all about really quick. Thanks, Angela.
Okay. Good evening. I'm Angela Freitas, the Director of Planning Community Development. The item is a consideration of readoption of an addendum to a negative declaration for the West Podesta Sewer Infrastructure Project. The board approved both the federal and state environmental for the project back in 2018, and at that time the project involved infrastructure that was going to be developed solely within the public right-of-way. In an effort to obtain state funding, the state wanted us to demonstrate that there was going to be a high degree of property owner willingness to connect the sewer to the sewer once it was connection, and to help to facilitate that connection, the state's willing to provide additional funding to cover the private sewer connection that will occur on the private property. The work to be done on the private property, however, triggered an addendum to the negative declaration that had been prepared in accordance with the California Environmental Quality Act. The Board of Supervisors adopted an addendum to the negative declaration in February of this year, and that addendum has since been rejected by the State Water Board because it was not distributed through the Governor's Office of Planning and Research clearinghouse, which is not required under CEQA, but is required under the state under what they call a CEQA Plus requirement, which they have implemented for federal funding. So this item seeks to readopt the addendum, which has now been distributed through the state clearinghouse as the State Water Board requires it to be so. So the need to do this readoption has created an extra step, but it hasn't necessarily delayed the funding. Since adoption of the original addendum, the county has been surveying the Spencer Marshall neighborhood property owners for confirmation of their willingness to connect to the sewer system. Getting responses to surveys is always a bit challenging, and with COVID made it a little bit more challenging. But to date, we have about 63% of the property owners in the neighborhood who have indicated a willingness to connect. The state has verbally indicated that the 63% will be sufficient to qualify for the funding, and so county planning and county public works are working to resubmit the application with the survey results and readopt the addendum for the negative declaration. So yeah, it's an extra step. We don't necessarily agree with the state, but they were pretty, heels in the sand, in the dirt, that we needed to do this, so we're here.
Perfect, very good. I just wanted to be able to explain that. It's almost like no good deed goes unpunished. Here we are doing everything we can. I know Miguel's been out there knocking on doors to try to get these people to sign up and agree to do this. And then, like you said, an extra step, but apparently it hasn't really delayed us at this point as far as the process. So anyway, thank you for just explaining what's going on. Again, I appreciate all the efforts and all we're trying to do for these communities. So thanks, Angela.
Thank you very
Thanks,
much.
Miguel.
Any other questions, comments? Okay, I'm going to bring it back to the board. We're going to take all of the consent calendar items together.
Okay,
Motion to approve all
Go ahead. Manny made a motion, Supervisor Graywall, and seconded by Supervisor
There we go.
Withrow. Yes. All those in favor say aye.
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 Opposed? Motion carries 5-0. Thank you. On to the first public hearing to consider the adoption. This is item 9-1. Public hearing to consider the adoption of the Stanislaus Urban County Fiscal Year 2020-2021 Consolidated Annual Performance and Evaluation Report for the Community Development Block Grant Program and Emergency Solutions Grants and Program. And when the time is appropriate, that we do have some public comment that was sent in. So that's to remind myself, because I always forget. Thank you. Angela and Anna.
Good evening again. I should have just stayed in my seat. So here with me to present this item is Anna Stanislaus. She is going to lead us down this presentation.
Okay. Good evening. This evening we have before you, County Planning has the Consolidated Annual Performance.
Get that mic right up there, or turn it up, please, because I am.
Can I take this down?
Yeah, if you want to pull that down, you've got 6 feet.
Okay.
Anyone's master.
So, thank you. This evening we have before you the Consolidated Annual Performance and Evaluation Report from the Planning Department. So, oops, not clicking. So what we have is Stanislaus County serves as the lead entity for the Stanislaus Urban County. We've been at U.S. Department of Housing and Urban Development, federal entitlement jurisdiction since 2001. Now, we have 7 of the 9 cities in our urban county, which is Ceres, Houston, Newman, Oakdale, Patterson, Waterford, and since 2020, we have City of Riverbank. Oh, it's having my back up here. And so our HUD requirement is to do a 5-year plan. Our last one that was approved by the board was on May 2020. So in that, we do annual reports on what we're going to be doing with our federal entitlement funds. And so at the end of the year, we do our CAPER, our Consolidated, again, Annual Performance Evaluation Report, to not just report on who was benefiting from the funding, but also the projects and the progress towards our 5-year goals. Now, our HUD entitlement funding for 2020 and 2021 fiscal year, we received approximately $2.4 million in the Community Development Block Grant, CDBG program, and $202,628 in our Emergency Solutions Federal ESG program. Now, in March 2020, we also were notified that we were receiving COVID pandemic relief funds that came through the U.S. Department of Housing and Urban Development for HUD jurisdictions. So there, we were able to receive an additional 1.3 in round 1 of COVID funding. There you go. And then we received in round 3 a 1.4, round 2 having gone to the state directly. And then for the ESG CARES funding, we received $698,717, and then $3.8 million in ESG CARES money for round 2. Now again, these these funds are for the urban county, so they're shared amongst the 7 cities, and county planning serves as the administrator for this funding. And we'll go into a little bit more detail in a second. Now, before you is a further breakdown of the funding, specifically the CDBG and the ESG federal funding. 2.4 is, again, allocated for 2020-2021. And you see, before you break down for the 7 cities, each city receives funding for their activities that's been approved through the annual action plan and administration. We set aside 20% that serves for the county's purpose for administrating the operations, day-to-day operations, monitoring, reporting of these funds. And then we also provide some funding to each of the 7 cities for their respective programs. We also set aside 15% for public services that is administered through a notice of funding availability annually, and we'll go into that. Excuse me. And then the fair housing, we set aside about $25,000 a year for a HUD-certified fair housing service provider that can provide assistance throughout the urban county for fair housing complaints and landlord mediation. For our ESG, we set aside 7.5%, the maximum allowed by HUD. For our admin, and 187,431 this last year was set aside for the eligible ESG activities for service providers that we'll go into. Now, the purpose of the CDBG program federal is to directly benefit low and moderate income people, help eliminate blight, and help neighborhoods, and meet a particular urgent need in the community. Now, the caveat with our COVID CDBG funding, or CDBG CV, was that not only was it for CDBG eligible activities, but it also had to be for preparing, preventing, and responding to COVID-19. Now, to give you a snapshot of the majority of the funding that we receive for these federal CDBG funds is infrastructure. The 7 cities and the county have focused and continue to focus on infrastructure and helping with health and safety issues in the community. So to give you a look there, about $23.3 million is approximately the estimate for the West Modesto Sewer Infrastructure Project. Now, prices are going, but again, that's our estimate. And right now, we've completed phase 2. And so at the end, it would be approximately 1,000 properties being benefiting. Right now, with the completion of phase 2, we have about 111 so far. Now, the urban county cities, the 7 of them combined would be 23 million also approximately, with about 6,000 properties being assisted, and we'll go into the different phases that those cities are with their projects. Now, each of the cities have their projects underway. City of Ceres was able to complete their project this last fiscal year. City of Waterford completed their Main Street infrastructure project, but will have to replace their project with another eligible one due to timeliness with HUD and some technicalities. They would need to, they weren't able to utilize their CDBG funding for that project, and we'll be proposing a project that City of Waterford will want to utilize their funding that's still remaining. While the rest of the cities are still in the process of design, engineering, and planning, and most importantly, saving funding for those costly infrastructure projects. Now, the 15% that was set aside for CDBG public services, we were able to fund through a competitive process 10 public service grants to those agencies before you: CASA, Center for Human Services, Children's Crisis Center, United Samaritans, and the Modesto Red Shield Center for the Salvation Army. Altogether, they were able to assist at least 2,408 unduplicated individuals. Before you have like breakdown of other interesting facts, like 237 were female head of households, 285 for individuals with disabilities. Now, again, these funds were not COVID related, but they continue to serve the public despite some staff shortages and dealing with the pandemic, not just with their clients, but with their staff. So we didn't really have any of them shut down during 2020, and some of them had to shift their business model and serving type of model, but they continued. And then we were able to fund 6 programs with our COVID CDBG CARES money, and we were able to do it in a competitive process for about $1 million. And we have another 1.3 still pending upcoming notice of funding availability later this month. Now, the Federal Emergency Solutions Grants Program, the purpose again has 4 major components. Emergency shelters, helping them with operations and services, rapidly rehousing the homeless, individuals and families, and homeless prevention, and then also helping us with data for our homeless management information system. Now, again, the purpose for our CARES money was, again, to prevent, prepare, and respond to COVID-19, as well as one of the eligible ESG activities. Now, through a competitive process again, we were able to award $187,000 for 3 public service grants, and we were able to do the ones before you with Family Promise to continue their shelter and their rental assistance program, community housing and shelter services to help us with HMIS, homeless management information data system, data entry, and the We Care program, their shelter out in Turlock. And so for the CARES funding, we were again able to fund 3 programs. Funds allocated were $628,846, with our set aside of 10% for admin. So although we received the CARES funding in 2020, we kind of got a late start. HUD actually didn't release our funding to us till approximately late May, and we were able to do agreements and put out the money in June. So when you see the progress of the 2020-2021 outcomes and progress for the 5-year plan, the consolidated plan, you'll notice that we didn't quite make it very far our first year for our CARES money, which is under the Community Emergency Response Goal under the consolidated plan. So we have a lot of zeros, but it doesn't mean that nothing was happening. It's just our agencies had about a month and a half to really service any people. And so we were, again, under some time constraints, but we are reporting what we have so far. So 65% for homeless individuals for the goal for 1 year was met, and then 28 for the 5-year goal. Now for our public infrastructure, we had a slow start. That's why we have a 7.4% for this year's goal. Most of the cities are still gearing up for construction, and we are hopeful that they'll be helping us meet our goal for next year. Public services, we far exceeded. We went to 120% of our goal. And then affordable housing, we were able to get pretty darn close to our 5-year goal with the help of one of our projects with NSP, funding neighborhood stabilization funding.
And I just wanted to ask, I wanted to be, this is the cumulative factor of all of the cities and the county's money?
Correct.
Being spent. Okay, thank you.
Yeah, sorry. So yeah, what you have on the left side is the consolidated plan goals, 4 of them that were set aside specifically for this funding for 5 years. And it's the whole county, urban county. Now, we had a public comment period open up on September 7th, and today we bring it to our public hearing. We did the following outreach. We did a presentation to the Continuum of Care monthly meeting on September 16th. We had an email blast with our draft of our CAPER for feedback and any community input. We also sent it out to our own email listserv, and we got 1 response from the CRLA, or Community Rural Legal Assistance. They had a few questions. asking about the services in the community and why there were less people served overall and less agencies funded. And we explained how the funding fluctuates according to availability. And then also people being served, there was some delay because of the people in the agencies not being able to continue to operate continuously. There was never a complete shutdown, but there was some staff shortages. And then we had our urban county members had their meetings with their respective city councils in the month of September. And we also posted our draft caper on the planning website. And then staff today is bringing forth a request to conduct a public hearing, and we are asking for the approval of the 2020-2021 caper and authorization for staff to incorporate any comments received and to submit to HUD the final caper and make any edits as directed by HUD. Any questions?
So I guess the question is it better because to spend money at a faster clip other than in programs as far as construction, do we trade money? Is it possible to trade money if Waterford has their downtown project and they're ready to go? Can we give them the money, all of it, and then the next year Riverbank has a project and so on and so forth?
We are able to trade money, but it's this, nobody has actually ever traded money, and there's kind of this on-off period where you're doing design engineering and then where you're doing construction. It's usually in construction where you're spending the most amount of money, and so you're kind of, you skip a year so you can save up the money. So it's just the alignment and the way that it works, and there haven't been a lot of opportunities to trade because nobody's quite ready to go yet and be able to use the money.
There's not enough money, right, and to probably even do design work that fast.
Yeah, you're leveraging with whatever else you can find, and in our case, we broke, the West Modesto projects in, 3 different neighborhoods, but we broke the first neighborhood into 5 phases because that's the only way we can construct it is in little incremental phases.
Yeah, very good. Other questions, comments before I open up the public hearing? Okay. I'm going to go ahead and open up the public hearing. Anyone to comment, come forward, please. State your name for the record. Seeing no one, I'm going to close the public hearing, bring it back to the board for actions or comments.
I'll make a motion to recommend all staff recommendations.
We have a motion and a second. All those in favor, say aye.
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 Opposed?
Aye.
Motion carries 5-0. Thank you very much.
Thank you.
Thanks, guys.
Yeah. We're going to take a 2-minute and 35-second break. Totally. Okay. Thank you for your patience. Everyone up here will be in a much better mood, for sure. All right, we're going to move on to item 9.2, public hearing to consider adoption of the recommended final budget for fiscal year 2021-22 and related actions. I'm going to ask Patrice, I'm assuming Patrice is starting, no, Jody's starting.
Yeah, I'm going to go ahead and kick us off, if that's okay.
The CEO, that would be great.
Okay, good evening, everybody. Tonight is once again my honor to present to you the recommended final budget for 2021 and 2022. As always, preparation of the county budget is a collaborative effort spanning the Chief Executive Office budget team and all of our county departments. Joining me tonight at the staff table are our Deputy Executive Officer, Angelica Ramos, as well as our Senior Management Consultant, Kelly Cavello. They will be joined by our Assistant Executive Officers, Raul Mendez and Patrice Dietrich, representing out for the rest of our CEO team. They will also be joined by several of our department heads who have been asked to assist in this evening's final budget report. And finally, you will notice many department heads, budget staff, joining us here in the chambers, while others may remain at their desks at 10th Street Place or in our overflow room. And all of us would be available to answer any questions that you may have as well. So believe it or not, even at this hour, we still have folks probably at their desks here at 10th Street Place watching tonight's budget presentation. We appreciate all the support from the county staff who have stayed here to help answer your questions. Also want to take a quick moment to recognize we have two of our new department heads joining us for the first time at the County Board of Supervisors meeting. I want to recognize Amanda Sharp, our new Community Services Agency Director. If you could raise your hand there. Amanda, it's very nice to see you. Welcome. As well as Robert Koslevy, our new Director of Environmental Resources. Robert, over in the corner. There you go. Welcome to the process. Before we begin, I want to thank the entire county team responsible for building the budget, many of whom you will see noted with over 100 names on pages 14 and 15 of the budget. Those are my favorite pages, so as you're skimming through the budget, please stop there and recognize those folks. This is a very complex puzzle of financial analysis and data reporting, and it's important that we begin tonight's presentation with our expression of gratitude for the very talented group of professionals who have developed the work that's before you this evening. So a year ago, I focused this budget message on balance. The challenge is in finding it, managing it, amidst the growing impacts arriving from our COVID-19 pandemic. A year later, I found myself continuing to focus on this message of balance that you have before you there. This 21-22 recommended final budget includes a series of recommendations that serve to support our departments and their growing needs in this new environment that we find ourselves in. To begin with, we recommend appropriations increases across nearly all departments, both externally and internally funded, along with an additional 58 full-time positions, the largest one-time addition in recent history. This level of investment in the organization recognizes the current financial strength of the county and allows us to shift from a more conservative approach adhered to over the past several years, especially since the recession. While it can certainly give me pause, it pulls me back to my focus on balance and what that means for the organization. You have a quote in front of you: balance is key. Without balance, there's conflict, a battle between positivity and negativity. One I had to really think about when I read that one. And while we have done some extraordinary things using a very lean county model here for many years, the strain it places on all aspects of the organization could lead us to a point of what we have to admit are diminishing returns. That ultimately impacts all county departments and the core services we provide to the community. So the recommendations included in this budget reflect this reality and the theme of balance needed between all of our departments providing direct community services and the many departments who support them indirectly. I want to also acknowledge that this budget does not resolve every issue brought forward by our departments for consideration. While we're pleased to bring forward many new service improvements in the community, we still have unresolved issues that will need to be reviewed during future budget cycles. Simply put, our work continues, and we're already planning for our next round of budget analysis and recommendations to further support our community. Okay, and then we're going to throw in a little new thing that we haven't done before, because this doesn't come up very often. It was a year and a half ago that the county organization was poised to move forward with a new vision and mission and a fresh perspective on our guiding principles for how we serve our community. We had rolled out a plan to our senior leadership, department heads, the board, county managers. It was the focus of a leadership retreat we actually held 2 years ago. And then COVID-19 hit. We were faced with a lot of other unknowns and uncertainties, and we had to recognize that rolling out a new vision and mission in the middle of an emergency response was ill-timed. So after a long pause in our process, we are very pleased to finally announce we are ready to roll out our new mission and vision. That was a pretty cool transition there. Thank you, Kelly. And this will help us begin to introduce ourselves in a new way to our county workforce and to the community. The mission is very, very simple and profound. We build community. Keeps us focused on exactly what we're doing every single day. And whenever there's doubt or confusion around what we're supposed to be doing, we can go back and ask ourselves that question. Are we taking steps to build community? And what type of community? Becoming a community of choice where people live, work, and thrive, a place worthy of calling home. So we're particularly proud of the simplicity and strength of the new mission. It encompasses so much of what we as an organization strive to do from all angles, from each of our priority areas, providing program services that, such as safety and health, promotion of learning, development of the economy, maintaining quality infrastructure, and providing efficient government services, all things that factor into the community that we strive to be. I often say that our county workforce is uniquely positioned to influence our collective future more than any other single group of individuals anywhere in Stanislaus County. I'm very proud to see us roll out this new mission and vision to reinforce the core impact of county services on our lives today and the critical role we play in shaping the community of our future generations. I do want to note that we still have more work to do here. We will take our time over this next year to actually revise our existing values that you see listed in the county budget. And I want to note that we had a couple of public comments specifically to our value statement as well. And I don't expect that everybody read the budget message as many times as I did. But in the budget message, I did try to write and reflect that the county value system, we're going to take some time for us to really do a deeper dive on. We've already identified some areas where we think we can improve the county value system. For now, we consider our county values to still be guiding principles for us, but we also acknowledge that they may be lacking in some areas that are important to us today, and we consider them under construction. So thank you all very much for allowing me the time to do that introduction, and thank you all to this entire team who put this together for you. I'm so pleased with the team that's gathered to present. I'm going to now turn the presentation over to our Assistant Executive Officer, Patrice Dietrich, and she's going to begin our review of all the highlights in this budget. Thank you, Patrice.
Thank you. I always like starting our budget presentation with a refocusing on what our vision and our mission is. That is what we hold in front of us as we establish our budget and try to work together with you on identifying all of our resources in support of your board's priorities. So on the screen, to begin with the budget figures, there's a table identifying the county's budget appropriations, revenue, and the use of fund balance retained earnings. It starts on the left side with the prior year final budget, the 2021 adopted final budget, and then in the middle shows the adopted proposed budget for 21-22 with the current recommended final budget on the right. The difference between the prior year and the final budget for 21-22 is actually a decrease. We're recommending a decrease of $36.6 million, and this is a decline of 2.5%. When we compare to the proposed budget, the recommended final budget at $1.5 billion is an increase of $27.1 million, or 1.8%. I think there might be a little, there it comes. So therefore, the recommended final budget is in the column on the far right. You can see the just under $1.5 billion of total spending authority in the appropriations. We will fund that with $1.4 billion in estimated revenue and the use of $58.1 million of fund balance retained earnings across the organization. For comparison, year over year, this chart identifies budget appropriations across all of our funds, beginning with 15-16 and coming through to the 21-22 final budget. On average, the annual increase through the most recent fiscal year 2021 amounted to 6.9%. And as I already mentioned, the recommended final budget will decrease by 2.5% from the prior year. And that is largely due to an accounting change that was recommended in our most recent comprehensive annual financial report. The independent auditors requested that we make a change affecting the Community Services Agency budget, which they did accommodate in this final budget, and we are recommending. It has no effect to the bottom line, and it will be discussed a little later in the presentation. Similar to the previous screen, this chart gives the historical budgeted appropriations, this time for the general fund only. There is a steady increase comparable to the first slide through the 21-22 recommended final budget, averaging around 7.8% annually, with a more modest 3.9% increase between 2021 and 21-22. I did want to comment on that dip there at proposed budget. What we were doing with proposed budget was really relying on the spending plan that we had set the prior year, and so it did not include a significant number of one-time projects, which we've now, those that are in process and needed to be rebudgeted, we've now brought them over, and they're included in our new 21-22 figure. Okay, here we have discretionary revenue. These are the funds that are available for programs at the direction and discretion of your board. The majority of these funds are used to support public safety, government-related services, and to meet mandated match requirements that leverage revenue for federal and state-supported programs, predominantly in the health and human services or community health priority area. The chart on this screen identifies actual discretionary revenue received from fiscal year 11-12 through 2021, and those are in the light pinkish color, along with the projections for the current fiscal year, both proposed and then the recommended final budget on the far right. The actual revenue received through fiscal year 2021 averages at about 6.2% year over year. The 21-22 recommended final budget includes discretionary revenue estimated at just about $257 million, or about $4 million, 1.4% higher than what we realized in 2021. Almost $16 million, or 6.4% over that included in the 21-22 adopted proposed budget. Again, that proposed budget was based on spending plan data that was established a year ago, and at the time that we did it, our projections anticipated that the original negative impact of COVID on the economy would continue and affect our sales tax earnings. And so as we were able to move forward, you can see that sales tax and our other discretionary revenues have essentially right-sized to be just a little bit above the prior year actuals. Okay, so this is a picture of our long-range model, and as a reminder, our annual budget analysis is always completed with attention to this multi-year long-range model, which provides guidance for our financial decisions. We have completed that long-range model through budget year 25-26, and we are relying on known and or other anticipated funding and expenditure projections that include escalation factors for the normal cost of doing business and identification of service needs in the future. So the graphic on the screen actually shows 3 prior years of actual general fund performance, the current budget, and then 4 years of projections. The funding or revenue is displayed in the white line, and you can see that it outpaced the actual expenditures in the maroon line in prior year actuals. The largest increase was in 2020. And again, you can see that that's some of the COVID impact. As we redirected our resources, there was an infusion of coronavirus relief funds that came in to help support our efforts. And then again, the economy outperformed our initial projections, so our revenue did come in higher. The projection years are identified by the dashed lines. The 21-22 recommended final budget and 22-23 are balanced with equal expenditures and funding sources. So beginning in 23-24, when those expenditure projections outpace our estimated funding, we will look at one-time funding solutions, which could include assignments, strategic reserves, or adjustments in our planned spending. Again, this is a picture of the long-range model. The actual model itself is detailed in the budget book and also summarized in the board agenda item on page 15. This slide just is summarizing notes of challenges and opportunities that are affecting our organization. They are affecting not just the organization, but they also reflect in common themes across our community and will require a collaborative approach for us to affect change. We have a series of challenges and opportunities identified in the budget book in each department area, and the themes that have risen to the top are displayed on the screen for you. The ongoing response to the COVID-19 pandemic, issues of services to assist with housing and homelessness across multiple departments and multiple priority areas. We also see a focus on improvements, improved efficiencies, continued efforts to upgrade technology to improve our business processes, as well attention to our aging facilities and infrastructure in order that we can maintain safety and security in our facilities for both the public and our employees. And then finally, a great focus on employee recruitment and retention, something we've been talking a lot about in our office and getting input on from department heads across the county, and really recognizing that we're going to need to be creative and look at our recruitment and retention at the highest levels of our leadership team and frame that work in a new way, working with our HR professionals. So all of those are summarized again in the department sections of the budget book. As you look at the budget book that is published, the 21-22 recommended final budget is organized again by board priority area, and they are noted by the shortened name in bold on the screen. Each one of those categories is a full priority section in the budget document, and we're going to use those priority areas to summarize our recommendations in the departments this evening. And as we begin to look at that, here is the final budget, just under $1.5 billion, the $1.489 billion as identified there on the screen. By board priority area, departments supporting community health account for the largest portion, representing about 42.2% of the overall appropriations. I noted previously that most of that funding comes from external federal and state funding sources. The departments supporting strong and safe neighborhoods make up about 20.5% of the budget, followed closely as you move through the donut display on the screen by delivering efficient public services, delivering community infrastructure, and then those departments developing a healthy economy and promoting first-rate learning, rounding out the totality of the county budget. And with that, I'm going to turn it over to Angelica, who's going to kick us off and take us through a summary of the final budget by priority area.
Thank you, Patrice. So the departments supporting strong and safe neighborhoods are identified on your screen. These departments combine for a total final budget of $305.3 million, which represents an increase of $14.9 million over the adopted proposed budget. I'll go through a little more detail about the requests that are recommended in the departments. They do include 18 new positions, which are recommended for this priority area. So a little more detail regarding recommended budget requests in this priority. We've got the district attorney who will be renewing contracts for specialized prosecution services, has included in their budget to continue technology projects, as well as to continue their support of the Family Justice Center. For the probation department, they will be funding the rollout of body-worn cameras and taser program, and we'll be funding that with the department's own special revenue. This will enhance staff and customer safety. The probation department will also continue progress on their Blue Gum parking lot safety and repair project, and will continue to support the county's CARE program. For the public defender, we're recommending adding one manager position to provide oversight of clerical accounting, management, and office operations. And for the sheriff, we are recommending the establishment of a Salida substation for improved services to this unincorporated community. The Salida substation will be staffed with one sergeant and 5 deputy sheriffs. As well, the department we are recommending 2 new staff to support technology needs in the department, as well as 9 additional positions to focus on administration, community services, and allow for redirection of multiple deputy sheriff positions to higher level law enforcement work. So included in this budget is a policy decision to implement a new contribution to community fire districts to provide relief from the negative impact of the Educational Revenue Augmentation Fund shift, commonly referred to as the ERAF shift. The funds would be allocated in a proportionate amount equal to the county's own ERAF impact after receiving the benefit of Prop 172 public safety sales tax revenue. This would be $800,000 to go to fire districts who are negatively impacted by ERAF as identified on the screen, and an additional $400,000 to be administered by the fire warden in partnership with the Fire Authority for the benefit of the fire response system throughout the county. And at this time, keeping with our recent tradition of inviting department heads to come and share a little about their departments, I'd like to invite our sheriff up to the podium to tell us a little bit about what's going on in the sheriff's department. Welcome, Sheriff.
Well, thank you, Angelica, and good evening, Mr. Chairman, members of the board, Mr. Hayes and Mr. Bose. Thank you for the opportunity to speak tonight. I will talk very briefly on 3 particular topics. First is, the county just kind of highlighted some of the challenges and opportunities. Right now, the Sheriff's Office has a great opportunity due to our staffing. Our staffing is so strong right now, the strongest position that we've had in 3 years, that we have the ability to return in force to Salida. Salida is the single largest community in the county, in the unincorporated portion of the county, and it is, quite frankly, underserved. That is a result, if we go back in history 10 or 12 years to the recession and the impact on staffing that had, we had to shrink our force, and consequently we came out of Salida. But given where we are at right now with our current staffing, now is the time for us to go back up there. We are doing great with our hiring, and we fully anticipate that by April 15th of next year, once these positions are approved by you all tonight, we will be able to reopen the Salida substation and get staff up there committed to that community full-time. That is different from having a full-time substation. There will be an office up there in some sort, but there is a meeting on Friday to kick off the development of what the physical location will be. There's a couple of options, and that will come before you in the future. But we will have the staff up there, and again, with some sort of temporary office. And the full long-term substation will come before you at a future time. Now, the second portion that I want to highlight tonight as you look at our staffing request is training or professional development staff. Professional development is one of my main initiatives at the Sheriff's Office, and it's more than just training in kind of that traditional sense. It's leadership development and professionalizing our staff more and more. So there are 2 positions on here that are specifically focused on that. One is an additional deputy, and then another one is a CSO. As we've restored the community service officer position, we have to incorporate more and better training for them. So we are adding that position as well. And then the final thing that I want to kind of highlight is support staff. CEO Hayes mentioned earlier this idea of bringing balance, and one of the things that we have to do at the Sheriff's Office is bring balance to our department. As we have restored staffing in the last 3 years, we have not kept up with some of our support staff, and consequently we find ourselves behind in finance, in IT, and some of our other key positions. One of the positions on here is for body cameras. We implemented those a couple years ago, and that has created Pandora's box, or opened Pandora's box worth of workload for getting that body camera footage out to the public or to any, through the district attorney's office, whatever the case may be. So we have to right size or bring that balance back to some of our support staff positions. So that is what you see in front of you, and I am happy to take any questions from any of you, should you have it.
Questions, comments?
I'm just going to go real quick. I was going to stand up and clap when you talked about the Salida substation, but I thought that probably would be appropriate. But I
would
really
have clapped
do
with you.
appreciate, Jeff, all your efforts to get that going. Like you said, it's been a long time coming. No fault of anybody's except the circumstances that we are in, but the stars have aligned now that we are finally in a position, and I so much appreciate your efforts to get this going. The people up there in Salida, I know, very much appreciate it also, and like I said, it's been a long time that they've waited and been very patient, and so thank you very much for helping make this happen.
Thank you for the support on that.
So I think you undersold yourself. For like the last 5 years, you've been the patient one. And again, I say this all the time, I very much appreciate, but the timing is right, and the finance is right, and it's time to do it. So appreciate your patience.
Thank you.
Supervisor Withrow. Any other questions? Thank you very much.
Thank you, Sheriff. So the departments in the supporting community health priority are noted on your screen and have a combined final budget of $629.4 million, which represents an overall decrease of $111 million from what was an adopted proposed budget. The net budget decrease in this priority is largely due to an accounting adjustment, as Patrice mentioned earlier, to remove $160.1 million from the Community Services Agency's budget. Excluding this required book entry, this priority would be increasing appropriations by $49.1 million, with the most significant adjustments attributed to support for ongoing COVID-19 activities in the Health Services Agency. So in Aging and Veteran Services, they will support the pandemic recovery services for the older adult population, as well as nutrition services, and the addition of one full-time community health worker position for the Health Insurance Counseling and Advocacy Program. In Behavioral Health and Recovery Services, they will be adding 7 positions across the department, along with contracted service provider benefits and medication services to benefit customers. In the Department of Child Support Services, this department will be deleting 7 vacant positions in order to align with available budget resources. In the Community Services Agency, they will be adding to the Housing and Homeless Services programs, along with a net of 2 new positions. In the Health Services Agency, this department will continue to support the public health COVID-19 response efforts and add 13 new positions related to this work and pandemic recovery, along with the addition of 2 positions for the medical therapy unit to keep up with caseload growth. And our next department presenter, Marianne Lilly, Executive Director of the Health Services Agency, is invited to come to the podium. She will take us through some current information related to her department. Welcome, Marianne.
Thank you. Hello again. I'm really pleased to have the opportunity to speak with you this evening about more of the whole Health Services Agency. Before you, can we go back to the first slide? Before you on this slide is an updated mission statement for our agency to promote improved health and wellness through services and collaboration for all people in Stanislaus County. And I want to point out that the background of the slides that we're using, it's kind of faint, but that is a picture of the Alms House that was built, I understand, in 1891 on the County Center 2 property. And I use that just to show that our mission really is a long-standing mission of this county in support of the health and well-being of our community. So in the Health Services Agency, we have tremendous number of programs and services, and not time to go through all that. So I thought what I would do would be to explain a little bit about the two different service divisions and what the difference is, and then talk a little bit about some of our achievements and challenges, opportunities going forward. You've heard an awful lot in the last year and a half about public health, but it's a lot more than communicable disease control that you've heard about. Public health's primary focus is really on the population, which is different than the clinical services, our clinic system, that the primary focus is on the individual. There's certainly some overlap between the two, but really the service emphasis on our clinics is what you would think about in your own doctor's office in terms of that one-on-one prevention and diagnosis and treatment to help improve the health of an individual on a one-on-one basis. Whereas in public health, we're working on a variety of different issues that have to do with the health and well-being of the entire population. That doesn't mean that everything that we do is exactly the same for the whole population. There are subpopulations or certain interventions, but and we don't do them alone. I mean, the public health is really, in order to move the needle, works with many organizations, other county departments, other leaders, schools throughout the county in order to try to improve the health and well-being of the whole community. Next, I just wanted to go through and talk a little bit about some of the achievements. Can we go to, there we go. And I'm not going to read this to you. I'm not going to go through all, but the Community Health Assessment and Community Health Improvement Plan is something we do every 5 years, and there was a lot of work done just before the pandemic. We compiled it, it's together, and we plan to come before you at another time to go through those in more detail. I want you to know, though, that during the pandemic, we launched telehealth services in our clinics. It was also something that was done with the MTU for the California Children's Services in an effort to continue access to care during this time, and we'll continue to do that. About 25% of our visits in our clinic system were done through telehealth, so we're very proud of being able to do that. Increased care gap patient participation. What that's really about is looking at, not just counting. You've heard Jody and others talk about results-based accountability, that it's not just about counting the services, but are we really making a difference? And that care gap is really looking at our patients through our electronic health system to identify and then target those patients to get them in to close those care gaps in an effort to really be able to improve the health of those patients. We leverage the HSA clinic system. You hear so much about what we've done in public health, but I want you to know that the clinic system has been very much involved in this pandemic response too. Specifically, the clinic staffing has helped to support first responder testing, outbreak testing still. If we have a particular outbreak in a congregate setting and we need a team to go in, our clinic system staffing is typically that team that goes in to support that effort. And then the last three, this is really about it's been a really tough last year and a half, but we are better. I mean, we're tired, but we are better. We are more capable, we're more knowledgeable. We've developed just crucial relationships. Gino being here, working with the hospitals and throughout the healthcare community and others. We've partnered with, and we have been so fortunately supported by so many other county departments. This hasn't just been about HSA, and we're truly grateful for that. In terms of challenges as we go forward, I've got several mentioned down here that I think all of you are somewhat familiar with, and you're going to hear more about, I think, in the coming months. But what I'll just close with is to say that I think that one of the greatest challenges going forward in terms of leading the Health Services Agency is about refocusing when the pandemic's not over. That we really, we've pulled so much attention to to this emergency response, and it's gone on for a long time. We can't continue to do that. We've really got to get to paying more attention to all of our programs and services, and in a way that, you know, we're measuring our performance, we're setting objectives, we're moving forward. So I think that's probably one of the greatest challenges for our agency going forward. So I will stop there, and if you have any questions, otherwise, move on.
Can I have a comment? So if there is a single department head that has the right to be a little down after the last 2 years, it would be you. And I am so excited sitting here listening to you talk about all the great things that are happening, continue to happen outside of your COVID response. Really, again, it's a tribute to why we're so successful in Stanislaus County, because of folks like yourself. And I know it's not all you, because there's lots of departments that are helping, but true leadership from you, Marianne, has really helped us get through this. I appreciate it.
And I'm just going to add to that, Marianne, we know you've suffered your own losses during these times, and most recently, and so anyway, our prayers are with your family, and just thank you for all you're doing.
Thank you. Thank you very much. Okay.
Okay, at this time, Assistant Executive Officer Raul Mendez will take us to the next few priorities.
Okay, departments developing a healthy economy are noted on the screen with a combined final budget totaling $25.1 million. Final budget adjustments are minimal in this priority area and result in a slight decrease in appropriations of $6,500. In the Economic Development Bank, we will carry over funds for the alley cleanup pilot program, the Salida CSA annexation, and Empire storm drain fencing. These are all projects that were previously approved by this board through your community development program. In workforce development, we will reduce appropriations to align with state allocations. It's important to note that although a reduction in appropriations is being recommended, this is not a reduction in services. The department is able to sustain program levels using prior year resources. And in the Agricultural Commissioner and Cooperative Extension, they are recognizing performance, visioning, carryover savings. The library represents the board's priority promoting first-rate learning with a final budget of $13.7 million. Recommended adjustments represent an increase of $1.2 million over the adopted proposed budget. Specifically, library services will benefit through additional extra help staff, contract support, and capital asset upgrades, including network infrastructure, exterior building improvements, lighting, replacement doors, and a 3D printer. As the board is well aware, in the last few months, we did dedicate 2 new libraries, one in Turlock and one in Empire. These adjustments will assist continue operations not only at those 2 branches, but the rest of the branches in the entire library system. Those departments in delivering community infrastructure are identified on the screen and combined for a total final budget of $24.5 million. Adjustments included in the final budget include appropriations of $103.7 million over what was provided in the adopted proposed budget. Primarily due to projects in public works and grant-funded activities to assist the county's homeless population in our Department of Planning and Community Development. A total of 13 new positions are also being recommended for departments in this priority area. The following are the recommended adjustments in this priority area. In environmental resources, this will support department operations, fund 2 previously vacant zoning enforcement officers, add 4 full-time positions to support Pink Road landfill, and operational costs for the groundwater program. In Parks and Recreation, it will support 4 park maintenance workers, positions at community parks, the LaGrange off-highway vehicle facility, Modesto Reservoir, Woodward Reservoir, along with funds for various park projects. and fixed assets necessary to maintain park facilities. In planning and community development, we will continue to work on board-approved grant-funded services to assist the county's homeless population. And lastly, in public works, it will support multi-year road and bridge projects, along with 5 new positions to support Morgan Shop, the stormwater management program, and various other public work projects. At this point, I will turn it back to Angelica, who will take us through the last priority area.
Thank you, Raul. In the priority area of delivering efficient public services, the departments are displayed on your screen, and their combined final budget totals $274.8 million, which is an increase of $18.3 million over that included in the adopted proposed budget for these departments. The increase is primarily attributed to technical adjustments, carrying forward appropriations from our performance visioning carryover savings program, and other administrative budget adjustments, along with carryover appropriations for multi-year projects, previously approved multi-year projects. In total, there are 9 new positions recommended within this priority area. So in the departments, we've got the assessor who will continue progress on their technology project to support commercial and industrial evaluation systems. In the Chief Executive Office and Human Relations, we will add a net 4 new positions to administer and account for federal funds related to the COVID-19 recovery, to provide cannabis program support, and to establish a department support unit to provide specialized human relations support and embedded management consultants in 19 departments, along with a closed captioning project and ADA compliance alterations here at 10th Street Place. For the clerk recorder, the focus is on an office remodel project and support of the 2022 gubernatorial election in the General Services Agency. They will address carryover projects for ADA, the Public Safety Master Plan, and deferred maintenance of county facilities, along with the addition of 5 new positions to benefit internal operations, including fleet services, facilities maintenance, parks and recreation project management, and county purchasing. And finally, a new contribution, as spoken of earlier, to fire districts is recommended in this budget to provide $1.2 million total of public safety sales tax revenue equal to the proportionate benefit received by the county after the loss of ERAF funds, as mentioned again earlier. And our next department presenter, Donna Linder, our County Clerk's Recorder and Registrar of Voters, is invited to the podium to tell us a little bit about what is going on in her department. Welcome, Donna.
Thank you. Good evening, Chairman Chiazza, CO Hayes, Council Bowes, and members of the board. The Clerk Recorder Department has 2 divisions, and I thought I would talk tonight about each of those divisions, give you some statistics, some changes going on there, and just give you an update. The first division is our Clerk Recorder Division, which has 34 positions, including administration, with 28 of those filled. In 2020, the Clerk's Division, the Clerk Recorder Division and the Clerk's Unit provided 2,458 marriage licenses, 4,992 passports, 12,742 other services, including fictitious business names, CEQA, notary bonds, and things like that. In our Vitals Unit, they provided 24,888 birth, death, and marriage certificates. And in the Recorder's Unit, 130,962 documents were recorded. In 2021, we're on track to either meet these same numbers or exceed them in many areas. With the business of this division, they also learned and trained on their new document management system, which was purchased and went live June 1st of 2021. This updated system allows them to streamline some of their processes, allowing people to order documents online and then come to the office and pick them up. The purchase of this system was necessary. Our old system had been used since 1993 and was outdated. The funds were used from our modernization unit, which is dedicated only to modernizing the office. This division will continue to grow and move and update. In October, 3 of the 5 units will be moving here to 1010 10th Street on the 4th floor, while that portion of the office is remodeled to meet ADA and safety compliance, among other things. The other division under the clerk quarter department is the election division with 14 positions, with all 14 of those filled. 2020 brought big changes to this department. With COVID, the elections was mandated to send every registered active voter a ballot, and then other bills were put into place on how we could help those voters in person. With this requirement and meeting these, Stanislaus County also had its largest turnout in history, or recent history, past 18 years that I know of, with a 77.76 turnout. To accomplish this, we also hired 174 part-time seasonal employees. When 2021 came along, COVID had not gone away, so Senate Bill 152 was passed, requiring, again, all registered voters in the year for every election to be conducted between January 21 to January 22nd to be mailed a ballot. Currently in legislation, Assembly Bill 37 will extend this requirement that requires all ballot to be mailed to every registered active voter. This bill has passed both houses and was enrolled September 8th. If the governor signs this bill, California will have from now on every registered active voter be mailed a ballot for any election that we conduct. We're currently experiencing high numbers of voter registration. It has increased substantially over the last few years. In 2017, 2018, we received 164,000 registrations, either new or updating their registration electronically and by paper. In 2019 and 2020, this increased to 314,000 documents, either by paper or electronically. We're currently finishing up our 3rd election of the year. The California gubernatorial recall election is still being processed. Also with Senate Bill 152, it extends the requirement of accepting a postmarked on Election Day ballot from 3 days to 7. So today was the last day to receive a ballot that would be postmarked. With Election Code 3019, it states that if any of those ballots are missing a signature or have a signature mismatch, that the voter must be contacted, so we mail them a form, and this must be done 8 days prior to certification. With these 2 laws and bills in place, our canvass will continue into middle of next week or longer. Any questions?
You've been busy.
Yeah.
For sure. Any questions? No, Donna?
Yeah.
You're doing great work. Again, it's not going to get easier, right? The elections aren't going to get easier. They're just going to get more difficult. And again, we appreciate all you do.
Thank you.
Thank you, Donna.
Thank you, Donna.
Thanks, Donna.
So this budget incorporates funding for 4,587 full-time allocated positions. This represents a net increase in the allocation count of 34 positions over the 4,553 approved in last year's adopted final budget. A net decrease of 24 positions were authorized during fiscal year 2020-2021, and a net increase of 58 positions are being recommended with this 21-22 final budget. So if approved, there will be 4,587 total authorized positions. The line chart on this slide depicts a comparison of the number of full-time allocated positions at the top of the chart in the light colored line, and a number of full-time employees shown, which is in the dark colored line, as of July 1st of each year since 2007. The recommended final budget position allocation, again, is 4587, and has been added to show the continued growth of position allocations. This is primarily due to mandated programs and increased need to provide services. At this level, we are 16 positions below our peak year, where we had 4,603 allocated positions in October of 2007. The figures listed indicate the percentage of positions vacant at this particular point in time, and the average vacancy rate between 2007 and 2021 countywide is 9.8%. The recent increase in vacancy rate, as displayed, is primarily due to a soft hiring freeze that was instituted shortly after COVID, where departments were only filling essential positions at the beginning of the pandemic. And some departments are also experiencing difficulties or a longer period of time needed to fill their essential positions. As a reminder, our county's budget, our 21-22 final budget, can be accessed on Stanislaus County's website at www.stancounty.com/budget. And Patrice will take us, Assistant Executive Officer Patrice will take us through the rest of the presentation.
So we're actually at the end of our presentation, our slides, and there are 10 staff recommendations that were listed on the board agenda item. They are detailed on the screen. I'm going to summarize them. Recommendation number 1 is that the board would please accept the 21-22 recommended final budget and recognize the new county mission and vision statements. Staff recommendation number 2, to consider the allocation of $1.2 million of Proposition 172 public safety sales tax revenue to support fire districts as included in the recommended final budget. And of that, $800,000 would be paid directly to individual fire districts who have been negatively impacted by the state ERAF shift, and $400,000 would be paid to Sheriff OES Fire Warden to administer through the Fire Authority. That is the recommendation as we have proposed it, and you all can consider that along with staff recommendation number 3, to conduct the scheduled public hearing to receive public comment and input on the recommended plan for 21-22. And again, that would bring our operational plan and spending authority to approximately $1.5 billion. Number 4, direct and approve any changes that your board chooses to make to the plan and then adopt the recommended final budget. Number 5, approve the restoration of the contingency reserve by increasing the general fund assignment by $1.5 million, consistent with the policy to retain at least 8% of the average annual discretionary revenue receipts from the preceding 3 years. And that is a longstanding policy detailed in the budget book. It's a technical adjustment to get there. Number 6, authorize the CEO and auditor controller to make the necessary technical adjustments to implement the budget. And then number 7, direct the CEO and auditor to prepare the final budget document and all of the appropriate schedules in accordance with state law to submit to the state controller, and that is required by law to be done by December 1st. Number 8, amend the salary and position allocation resolution to reflect the recommended changes that have been summarized for you. They are also outlined in the staffing impacts section, which is attachment 2 in detail, and they would all become effective the start of the first full pay period on or after September 25, unless otherwise indicated. And number 9, approve contracts and agreements, which are displayed in attachment 3, greater than cumulative amounts of $200,000 or greater since July 1 of 2019, and then authorize the GSA Director Purchasing Agent or previously authorized department head to sign. And finally, number 10, which is a very technical statement. I'm going to read verbatim. This is approve a total appropriations budgetary limit for annual appropriations of tax revenue for fiscal year 21-22 in accordance with provisions of laws Prop 4 and 111, and establish a general operating limit as stated on the screen using a methodology called population and inflation per attachment 6. That staff recommendation is related to an analysis that is done by our auditor controller, and essentially it is a validation process that she and her team do to be sure that we are remaining within the limit that is established by law, and I'm happy to report her analysis indicates that we are. So there you have 10 staff recommendations, and you can consider them in total or individually how you would like.
Okay. We are going to have a public hearing. Are there any questions of staff before we go to the public hearing? Okay. I'm going to go ahead and open the public hearing then. I do have two emails that were sent in for public comment. One was from Frank Plouffe, who was requesting that with the homeless population over 200 or 2,000 people, why isn't the county allocating reserve monies to increase the capacity to treat them? That's the first one. And then Noe Paramo sent in, reflecting back to a letter he had sent in previously regarding that the 2021-2022 budget does not advance the Racial Equity and Social Justice Initiative, provisions of services in the use of American Rescue Plan Act. And it refers back again to a letter he had sent, let's see, on August 17th. So those are into the record. Is there anyone else that would like to comment? Please come forward, state your name for the record.
Okay, Mr. Chairman, my name is Stephen Morrow, and I have basically a quick question and then a comment. Early in the presentation, it was mentioned that the approximately $58 million was going to be used out of retained earnings in this budget to help close the gap between the expected revenues and the budgeted expenditures. Now, if that budget pencils out as is, approximately how much would that leave in the county's retained earnings position? Full disclosure, I did not read the 636-page budget before coming to the meeting tonight.
So I can have Patrice come up, but there's sufficient money. That's what I can tell you. But,
okay.
Is that your only question, Steve?
That's my only question. While she's looking that up, I'll make a comment.
Okay.
During the years that I serviced copiers in this county, I serviced a lot of the agencies, and I think the hardworking frontline workers sometimes don't get enough credit for their service and dedication because they are hardworking and really care about the people that they serve, which is us. And so I just wanted to offer kudos to them.
Thank you very much. Patrice?
That was so incredibly nice. I would look up any number you want to hear. Thank you. Thank you for that kudo to the whole county team. I believe the question was, if this budget is approved as presented, what does that do to our fund balance across the organization? So if you are looking at the board agenda item on page 14, there is a little summary of fund balance that displays for the entire organization. And well, actually, it's the general fund that is being summarized on that particular page. We're starting the year, July 1, 21, with $254.3 million. The general fund would be projected to be $249 million by the end of the year. And that is general fund specific.
Okay. I'll read that carefully.
Page 14. All right. Thank you. Anyone else? Any other comments regarding the budget? Seeing none, I'm going to close the public hearing and bring it back to the board for comments, thoughts. Anyone have any thoughts?
Okay,
All right.
I will go. So as always, first, just thank you guys. I mean, I say this every time, we all say it every time. We've all been briefed on this, we've all had our input, and things have moved all over the place based on our input to some extent. And so by the time it gets to us here, we always say this, we have pretty much all had input on it, to some extent on the budget, and appreciate the briefings that we get. You guys are so talented as far as putting this thing together. I never fails to amaze me how well you guys do this and the efforts that you put forward to do this, the long-range planning that you do, and it keeps us from having surprises. Surprises are not good when it comes to accounting. You want to have that consistency and that to be able to have numbers you can rely on and not have surprises that pop up. And you guys do everything you can to make sure we aren't surprised. And usually we end up in better shape than we had anticipated. It's just that conservative nature of this board and the history of this board, and then of all of you in the policies that you guys work on here that come from the board. So we're just so blessed to have all of you and the work that you do on this. This is always my favorite time of the year, the adopted final budget. That sounds weird. There's a lot of favorite times of the year, but for an accountant, the adopted final budget is a big deal because we're dealing with, we've had final numbers from the previous year. We're always dealing with our budgets and projections and things like that, but we like final numbers. Where did we actually end up? What was the actual numbers? And at this point, we get those actual numbers from last year as we move forward. So it's a, sounds kind of weird, but it's a fun time to be able to see the actual numbers and where we go. Just a couple of quick things that I really think are great about this and that we continue to do is the reserves. And things are going really well right now financially as far as the county is concerned. We are in very good shape. The government has printed money like crazy and been handing it out to us, not only to us counties up and down this state, whether it's from the federal or state governments, which helps us be in that. Even without that, though, I know we would be in good shape. And so what we always have to prepare for is that next downturn. And that's what I love about the budgets and what we do here is we're always getting ready for that next downturn. You look at the reserve, the contingency reserve, we're making sure we keep that at 8%, I guess, is the number that we have. And we started that, I don't know how many years ago, but it's just great to have that money there for when those downturns happen. When I first started on this board, when Vito first started on this board, we were in the heat of the downturn. And it was, thank God we had those reserves sitting there to help us get through those times so that we could still continue to provide services to this community with those reserves that we have. So very, very proud of that we do that and continue to do that. And as we get ready for the next downturn, which will come, we know that day's coming. And that's what our long-range planning helps us work towards. The other thing I just want to point out is the number of employees that we've allocated. I know it's not the actual amount that we have working, but these allocations. If you compare this to where we were, and we showed where we were back in 2007, I think 4,603 was how much we had allocated position. Here we are today at 4,587, so still below by 16 employees where we were, 14 years ago. And I just looked up just to see, our budget now about $1.5 billion budget. It was $945 million back then. So we're getting so much more bang for our buck. If you look about it, we have a 70% increase in our budget compared to back then, but we still have less employees providing that service. So we're so much, in an accountant's mind, that's a more efficient operation. And so, again, so very proud of all you're doing here. So I support this, support the work you guys have done. You make us all look good. You make this county look good, and you help us be able to continue to provide services to this community in a very efficient manner, and you allow us to be able to continue through good times and bad. So I thank you guys very much, and good job on the final adopted budget.
Big words. Thank you.
Just want to kind of say, sorry. See, after not talking for such a long time, it's so nice to just take off your mask and talk. But I just want to share some of the sentiments that Supervisor Withrow. For the public's consumption, we get many, many briefings on the budget, and we ask a lot of questions to the point sometimes I think staff gets a little annoyed with the amount of questions we ask. But for a guy that's not very good with numbers, it helps asking those questions many, many times. And again, the reserves. I know people sometimes ask, that's a lot of money. Why aren't you spending it on other things? But it's what, as a business owner myself, you always don't look at the times when times are good. You look at it when times may not be as good, and then you're prepared to really carry yourself if need be. So I appreciate that, and I think we're still providing a good service. at a point where we're still able to keep those reserves. If there was a downward trend in services, then I think it would be a different conversation. But I think safety-wise, adding more positions, infrastructure, and then the ARPA funds did help with that. A lot of the money that came in through the American Recovery Plan funds are being put towards economic development, towards infrastructure, towards helping for affordable housing with CDCs and different things as such. So I think with the amount of money that's come into the county, we've really looked at ways to really accelerate services, and still having that reserve is just an added bonus. Coming from a city that, you know, it's always sometimes a struggle because of different things that cities have to deal with that counties sometimes don't have to deal with. It's just very reassuring to see the amount of work and the amount of planning that goes into this budget. So again, if we don't have any questions, it's not that they haven't been asked, it's just that they've been answered many, many times in other discussions that have been had prior to this presentation. Thank you to staff. I don't get as excited as Supervisor Withrow does about this kind of stuff, but it is pretty exciting to do the first budget as a county board of supervisor. This was my first go around doing it, and I really thoroughly enjoyed it. Hopefully I'm as excited as Supervisor Withrow next time as well.
Thank you.
I'd have to echo the sentiments of Manny on that about the excitement. Terry always gets excited about talking about numbers. But reading this budget, it was a little harder for me, and I asked a lot of questions and asked for a lot of information and got it within a couple days. So I want to thank Patrice and her team on getting me that information, and congratulate everybody that had something to do with putting this budget together. I know it's a lot of hard work, and I really appreciate it very much. With that being said, I want to talk about number 2 on the staff recommendations, about the ERAF. Ever since ERAF took effect, public safety money has been evaporating from District 1 to the tune, at least of my calculations, since '95, to the tune of $16.7 million that has been lost to ERAF since that entire time. And we're talking now about Prop 172 backfilling some of that money, not the $16.7 million that's been lost, but starting to augment those losses of ERAF. And just having that discussion about Prop 172 to offset those losses of ERAF shows that this board values our fire districts and the value they provide in our #1 priority of supporting strong and safe neighborhoods. Man, I gotta get rid of this mess. It's driving me crazy. Sorry about that. However, I would propose or motion, I'm not quite sure how we should go about this or if it leads to more discussion, that we look at funding the entire loss of ERAF to the fire districts, and then what is left, using that Stanislaus County loss, the Stanislaus County fire loss, to do the fire system enhancement that we talked about, that $400,000. So that's what I'm looking at. I know District 1 suffers the most when it comes to ERAF in those fire districts, and I think we ought to give them a chance to get back up and be able to provide those services that have been lost, so to speak, to those monies that have been lost. So I think that's a discussion that we could have and see where that leads.
Thank you. Jens. So these are definitely the best of times since I've been on this board, no doubt about it. I just was looking at all the numbers from the low point 11 years ago. Sales tax, we had $10 million in the unincorporated area. We have $30 million in last year's budget. Prop 172, which is another sales tax derivative, $28.7 million up to $46.3 million. Property tax from $80 million to $140 million. And people are paying those. Again, it's not our money, but we've seen this incredible growth from the bottom. I want to go back to, what Supervisor Withrow was talking about, and I think about all these very positive momentum, but I went back and I just quickly looked through the state budget. I think about Proposition 13 was passed in 1977, and it was about $7 billion that they took from county government, which was fined counties and cities. ERAF 1, which Supervisor Condit was referring to, was a $3.6 billion permanent shift, and it did ensnare fires. I had to figure out why some fire departments actually ended up positive. It was a real oddity, but there was, through ERAF 2, there wasn't a shift, and then they allowed the Special District Augmentation Fund to become a part of their allotment, I guess, for lack of a better word. So some of them actually came out on the positive side. And ERAF 3 shift was 2004, 2005, 2005, 2006. There was a temporary $1.3 billion shift. I look at the Great Recession and how we lost 1,000 positions here in Stanislaus County. Pretty stunning. I think we went down to about $140 million, and we're at 254 right now, just as an example. We're a low property tax county. AB 8 shifted money and actually gave us negative bailout, another punishment. And there's no way to fix the low property tax county because the only way, it's a zero-sum game. Some county will have to give up money and in order for us to be held right. But through all of that, I'm just amazed at how, even though I believe we're disadvantaged against a lot of other counties in California, we've been able to come back with sometimes austere budgets, but we've been able to build a reserve because we've seen some really bad times. An amazing statistic is that San Francisco has 58% more population than us, and we received more sales tax last year than San Francisco made. I don't know that anyone believes that that's going to stay that way. The nice part is that Prop 172, which is again a statewide sales tax, they lump it all together, and then you get a percentage based on the sales within your county. And something terrific has happened in this, the horror of COVID, is that people stayed home here and they weren't traveling to San Francisco and Monterey and San Luis Obispo and Orange County, Disneyland, and they spent their money locally. They bought RVs, they bought vehicles, and so we now are a bigger percentage for a short term, maybe 2 years, but we're a bigger percentage of the Prop 172 pool. So we're seeing big gains, but nobody can expect that San Francisco is not going to outpace us on sales tax into the future. But we're going to take that money now and we're going to put it to good use. As I was looking through, I always like to put the positives and the negatives. On the positive side, I talked about property tax being up another 4% sales tax. And I got the first month of Measure L sales tax, and it was up $800,000 on $4.3 million. That was $800,000 year over year. And I just got that number today. So it continues again. I don't know how long it'll last, but it's still continuing to show robust growth. And sometimes when I look at, I think, Steve, you had referred to, we have something called fund balance. It's carryover money that's not spent. And we have 14% of our positions. It's the highest vacancy rate we've had, if you look at that chart in recent memory. And if you go back to our low point of 3,608 positions, and you look at today, the 4,529 positions, the vast majority of that growth is not in discretionary spending departments, which means typically public safety. The growth, the vast majority of those positions are in state and federal funding. We do have maintenance of efforts to come up with. There are components we have to pay for portions of programs, but realignment, which is, and I always get myself too far in the weeds, but realignment growth has allowed us to cover those increasing costs because sales tax is growing at such a rapid pace. So that's when I think through the best of times, but we have a bunch of money we didn't spend last year that we had allocated to departments because, department heads are, again, very conservative in the way they approach. We've had difficulty in hiring like just about every business and retaining employees. That's why we heard we're going to make a concerted effort, because 14% vacancy rate is not a good thing. That's a service that should have been provided to the unincorporated area. We have a ton of deferred maintenance. I think about all the buildings. You know, we build new buildings, and we dedicate new libraries, and we have old libraries that we don't tear down. We have 2 hospitals we don't tear down. The public health department, they live in a bunch of modulars next to the coroner's facility. And I just think through these things, and we have a potential opportunity to spend one-time money and do some of these things we've only talked about. And the ARPA funding and the CARES Act funding that we've received from the federal government, putting $50 million into some infrastructure into the county islands. I mean, there's a lot of good that can come, but putting money in and allocating money that's not ongoing revenue beyond what is traditional growth is probably not prudent on an ongoing basis. It just, again, it sounds funny because we need to close the vacancy rate, and then we're going to spend all of the money that we put in the budget, which gets us to a couple of $1 million out of our reserves, a few $1 million out of our reserves. I know that Supervisor Condit, I know I've been the most reluctant to spend any money on fire on an ongoing basis, especially the ERAF, the shortfall in ERAF. When I look back, and I always sit and spend time looking back, but when I look back, the county is still short $16 million in this year because of the ERAF shift. And so we're not made whole. I think to the tune, if Prop 172 didn't come around, we have about $1 billion loss over the last 27 years in the county. We're low property tax. I add all these things up, and it's a fundamental unfairness that's been bestowed upon us. Prop 172, because of its tremendous growth this year, has given us some breathing room, but we're still short of services we should be providing to the community. So I've been very reluctant to start funding the fire departments outside of the Office of Emergency Services. I've been a big supporter because as a story, I went to the Denair Fire District Board meeting after the MAC meeting a week ago, Tuesday, and they were adopting their budget. And if you take out the strike team, which is them going out on, they're getting paid for that. But if you take it out, their base budget in Denair is $398,000. And Mountain View, at their board meeting, their base budget is $174,000. And so I'm always trying to prop up the volunteer departments, and I'm trying not to be at the expense, but the capabilities of training and the litany of things that are put upon them is very difficult. And that's why I know we came up with what I think is a compromise where we put $400,000, and then we made the ERAF shift an equal loser. The reason that I don't want to make them whole is, first of all, it wouldn't be fair to the taxpayers of Stanislaus County who aren't receiving the full share of the ERAF shift, and we're funding something outside. It doesn't seem right to make fire departments whole and the county not whole. So that's not something I'll be supportive of. This is, and I've got great respect for the paid departments, the folks that lost money in ERAF shift, and everyone has to do their jobs, but I've got Westport, whose budget I think is smaller than Turlock Rural Fire Department, Houston Fire Department, Denair, Keys, and I go to their, matter of fact, there was a Keys board member out here earlier, and they are really struggling. And again, on a $174,000 budget, that's why they're having chicken barbecues to raise money. So, and we still have tax sharing negotiations going on with cities, so long-term, we have to think about the bad times. If we give it to OES, some money to OES, and we end up in a position where we can't afford it, we can pull some money back. Putting it in everyone's base budget and fire agencies, other fire agencies, is going to be very difficult to claw it back just in a bad time. So I think we've struck a good balance. I feel, pretty confident in the way we've done it. Again, knowing that I was the most reluctant to do this, this is a big leap for me. At least I feel it's a big leap. It may not be a big leap, but I feel like it's a big leap for me. And yeah, and so, all right, so now having said that, I support the recommendation that's there, but there is one thing I want to change in the recommendation also as we go forward. It says the money goes into Office of Emergency Services, and it will be determined by, I have to read the exact language. I got it right here. And the fire authority, administered through the fire authority with the benefit to countywide fire response. And that money is specifically for volunteer departments, so I'd like to strike the fire authority, give it to OES, and let you determine with the volunteer departments. I think that's a component of it. Last thing, to the staff and department heads and county employees, I can never say it enough, how thankful I am. This has been the greatest job for 13 years. Amazing, just truly amazing people. And
Mr. Chair, just for clarification, did the representative from District 1, was that an official motion, or were you just having dialogue?
we're having dialogue. Everyone gets to speak before we start doing motions, and I'll allow you the first motion. But just absolutely amazing people. We couldn't do it. We have the easiest of the jobs out of the 4,600 or 4,520 some odd employees, because we get great information. But everyone is trying really hard. Kudos to you. Hats off. I'm excited about this budget, and again, but I know the bad budget is coming, so I want to strike this really positive. This is a 4/5 vote requirement for the budget. We can take it individually, if that's what the board chooses. Take item 2 to see if we can get consensus, or we can go for the full Monty each time. I don't know what the preference of the board is. I'd prefer we shoot on number 2 by itself, if that's okay. Is that okay?
That would be fine. I'd just like more clarification on what the change, proposed change.
Okay, so there would be no, I'm going to allow Supervisor Condit to make the first motion.
Okay, my motion would be that we backfill ERAF loss to the fire districts that lose with Prop 172 funds, and then use the Stanislaus County Fire loss of ERAF, which is one of the sheets in our budget briefing that we had, which is $120,244, to be used as the Fire Service Enhancement Fund, which would go to OES, which all fire service could use, not just volunteers.
So 1.2 million essentially to ERAF backfill, and then 122,000 to OES. Is that
the loss of the ERAF? If that comes out to the 1.2, yeah, ish.
Okay.
Thank you very much for the opportunity to chime in here. I do think we want to be real crystal clear about exactly what the motion is. I think we have a slide that depicts the total ERAF loss. So if we could maybe try to fast forward to that, I think it will provide some clarity. There you go. So Supervisor Condit, just for clarification, if you see the slide in front of you, it depicts total ERAF loss for the districts at $1.24 million, and it refers to an amount of $120,244 under the county fire category. If we were to fully abate this loss, as you see before you on the screen, that $120,000 would abate back to county fire, which would go to the Office of Emergency Services Fire Warden's Office. They typically program those funds as revenue that's considered in the annual Fire Authority business plan. So it would go through that normal process. And I just want to clarify that was the intent.
Yes.
So just to make sure I understand, so if we're talking about the 1.2 million, and then in addition, we're adding 120,000, is that right? To get us to 1.3, actually 20, yeah.
That's not my intent.
1,322,240. I think that, so are we going to pull, because we're talking about 1.2 million to go. And if we're going to have 120
Subtract the
go to.
120 out.
So then the 1.2 would come down to actually $1,080,000, $1,020,000, okay. Yeah. $1,080,000. It's okay. So that's what, Buck, I just want to make sure. So it won't be a full 1.2 going then. It's going to be down to $1 million.
Subtract the county fire portion
Yeah,
out.
right.
1.12 million, more or less, with the change, and then 120,000 instead of the 400,000 to OES for volunteer. Okay, so are we clear on that?
I think so, yeah.
Okay.
I just want to be sure on the number. Are we sure on that number? 1, 2, 3.
Do you understand?
Okay, is there a second on that motion?
Second.
Second. Now, any more discussion? I'll have to say my piece again. It's not something I can support. We're cutting off the volunteer districts, which I think are,
$1,079,000.
so important to the overall fire delivery system. So this is not something I'm going to support.
A lot of those fire districts, though, too, that are volunteer lose ERAF money, so they are gaining more money.
So $400,000 right now, if you look through there, if we're going to put $400,000, the ERAF loss is nowhere near that. So it would be a huge net negative from what we have on today's budget for the volunteer fire departments.
So just to make sure we understand, so we're talking about $1,079,756 if we actually want to look right at the numbers going towards for the 172, and then 120,244, which would go towards the fire authority to get us. That's the $1.2 million altogether, as compared to $800,000 going for the ERAF loss and $400,000 going to the fire authority.
Correct.
Was that?
I'm sorry, I do need to clarify. I think I heard Supervisor Chiesa clarify his preference that the fire authority would not program the 400,000.
Right, go to the volunteers.
Specifically for volunteers. But I want to acknowledge the recommendation before you in the budget agenda item is slightly different than what Chairman Chiesa mentioned.
But there is a motion. So any more discussion?
Yeah, I just want us to try to negotiate a little bit more before we have to vote on this thing here, to see if there's any way that we can get consensus. Sorry, that's what I do. Can we split the baby here a little bit? I mean, would there be an appetite for, dropping it down to $1,200,000 as compared to what we have on here, $1,200,000, $200,000 going to the volunteers, $1 million going to.
And I am always,
No,
and
I know.
I'm always
I know you
the
are.
peacemaker around here. I cannot, and I hate to say the word cannot because this is so unlike me, but the volunteer departments, if you think about, we're using some money this year to hire a training officer, one person to try and take care of all these volunteer departments, to try and bring them into compliance because it's overwhelming. Remember the $174,000 of Mountain View Fire. They got to put diesel in those trucks. They got turnouts that cost the same amount of money. They have oxygen bottles, and it's not that base budget. They have chicken barbecues to raise money to fix it. And I think that if $400,000 to support the volunteer departments is $1 million. And as a matter of fact, I would flip the script and say 800,000 should go to the volunteers and 400,000 should go for the ERAF loss. But those are my thoughts. But
it's okay.
We'll just take the vote and see where.
Mr. Chairman, Mountain View Fire, if we were to backfill the total loss of ERAF for Mountain View, it would be $45,614.
Yes.
That would help Mountain View.
It would. And Westport would get $2,900, and Houston wouldn't get anything, and Keys wouldn't get anything. And I mean, so it does help a few people, but it doesn't help everyone.
Correct, and some of those departments have actually gained from ERAF.
I'm very familiar, yeah.
No, I understand.
Yeah.
I'm just telling you the facts on those.
Okay, so anyways, we have a motion, we have a second on the floor, and the money is to go through the fire authority based on your motion. The same thing that is number 2 minus the money goes through OES Fire Authority, the $120,000.
Yes.
So I just, okay, I want to check on that. So, so Buck, you don't want it to go to the volunteers? Because the fire authority at this point is pretty much controlled by, so I'm not sure how much that will get to the volunteers.
If we're
And
talking
so-
about system enhancement, we're talking about the whole system. We can't start segregating whether you're volunteer or paid. This whole system works together. That's how it works. We don't need to separate volunteer departments from career departments. That's not how the fire service works. They all work together. So separating one out, saying, you know, we're going to support the volunteers with this one, but we're going to leave everybody else out. That's not how the system works. That's not how the mutual aid system works. They all work together.
So, but the reality of it is, I hear what you're saying. The reality of it is that money will go to the fire authority, and then they will vote on how that money is going to be spent. And that vote is heavily weighted, right?
I'm not quite sure how they weight their vote as far as that goes, but I think as a system as a whole, they decide that they make a business plan and they go forth with that business plan.
Okay, this is fun.
Okay, clerk, I'm going to have you actually call the roll.
Before, I just want to clarify that I'm fully understanding the motion that's being made, just for the minute's benefit. If I understand correctly, Supervisor Betconda is making the motion to amend staff recommendation number 2 to consider the allocation, and it's going to be $1,120,620. Is that right? Of Proposition 172, Public Safety Sales Tax Revenue to support fire districts as included in the recommended final budget. $800,000 to be paid. Is that correct still? That's okay, so that's no longer there. And this money is going to be paid directly to individual fire districts negatively impacted by the state's Educational Revenue Augmentation Fund shift. And then there would be $120,244 paid to the Sheriff's Office of Emergency Services Fire Warden to administer through the Fire Authority for the benefit of the countywide fire response system. Is that correct? Do I thank you for that?
Okay, so I'm gonna, sorry, Chair, sorry, one more time. So
And I've
we're-
got one more after you, too.
Okay, so I guess, so now we're going from the 400,000 down to 120,000, and it's going to go to the fire authority, not to the volunteers. I guess I could support it if we got it, at least that to the directly to the volunteers. But if we're not even going to give that,
Well, how does doesn't the fire authority speak for the volunteer departments? Aren't they? I'm not quite sure. I was never in that group. I was on the engine and didn't wear bugles on my shirt, so I wasn't a chief.
Well, no, that's a good question, but I just, from what I understand, I could be wrong, that I'm not sure how many of the volunteers are even showing up at the fire authority meetings anymore. And so I just, anyway.
Chief Murdoch? Hate to put you in that position.
That's okay. I was waiting for this opportunity to come up here. So, speaking on behalf of the fire authority, we don't have a turnout as we would like to see with regards to volunteer fire chiefs participating in the voting. We give every opportunity for them to be there, and some of them do call in, but again, we do have some problems with having consistency with volunteer fire chiefs attending the meeting. The whole focus when the fire authority was developed years ago, it was to have a collaboration and cooperation and communication to have one focus for fire within Stanislaus County, and that was the intent of the Regional Fire Authority, was to bring everybody together so we can move in one direction And it's been a challenge. And a lot of the challenges, we just don't have the participation as we would like to see.
So I think that kind of answers my question, I think, about the 120,000. Just the way it, not nobody's fault. It's just the way it's. So I guess I could support this with you, Buck, if I could just, at least if we could get the 120,000 going towards the volunteers.
I can do that.
Just a little negotiation.
If we want to augment or change the motion, then we can do that. That the 120,000 go to the volunteer. How do you even do that? How is it available to the volunteers? And
I guess
it still has to go through the fire authority or through the OES, right?
Right. I'm sure we could, easily identify.
Yep.
And,
Yeah, but, sorry to interrupt. And obviously, reading between the lines, it's a 4/5 vote, so if not, then we're just back to square one. So in the spirit of compromise, I think if we can just mandate in the motion that it goes to volunteer departments, rather, to OES, so I think it would be a second step. It would go to OES because they kind of oversee the disbursement, but the disbursement be kind of mandated from the board that it goes just strictly to volunteer departments. I think that'd probably be the compromise. That would make me comfortable as well, because I can feel what Chairman Keyes is saying, where some of the volunteer firefighters, although they didn't experience ERAF loss, but they also don't get the benefit of this passing, would get some of those funds directly allocated to them. So in the spirit of compromise and reading between the lines that it needs a 4/5 vote, I'd rather have something done tonight than it be at gridlock and nothing be done.
And I had one more question for Patrice. Is 172, or is it still tracking to jump up to 58 million? Are we still tracking in that regard?
So,
From 49 to 58?
you guys are, you say you're not good with numbers, but you are tracking numbers in a beautiful way.
Just because I have them in front of me.
Well, okay. So the actuals year-to-date last year, June, yes, 49.5, there you are. And we have included in our recommended budget 55.9 million. That is our projection in the current year.
Thank you.
I remember in budget hearings, hearing Patrice that number might change. I mean, we have it plugged in to where we have it plugged in, but I recall that $58 million number as well. I don't know in what context it was brought up, but I thought.
So the 55.9 million was the original estimate that we have in the budget, and I think we did share that our sales tax consultants, HDL, is contemplating that there could be a greater drawdown to us because of our participation in the pool, as Supervisor Chiesa was describing. And we won't know that for a while. There is a 2-month delay, as you know, in sales tax coming in, but they did indicate that in their forecast, and we would be tracking on that. Am I reporting that correctly?
And I'm wondering if also in the documentation that we shared in board briefings, the county-wide share of Prop 172 to include the cities was $58.9 million, and Stanislaus County's share of that would be 55.9, which is what we included in our projections for our county budget.
Right.
But Angelica, that number can go, based on HDLs, it can go up to 58.9
Yes.
just on the county share, not on the cities.
That just goes into the whole pool, because we way overspend on public safety, right? We're at 157 million this year. And so we meet our maintenance of effort, so it's the color of money. It just becomes sales tax, essentially.
True. We do way over meet the maintenance
Yeah.
of effort requirement for public safety.
Okay. All right, so now it's the fire authority has been removed. Are you good with that? Hey, do you understand? Moving the language on fire authority?
Correct. And it's now for the benefit of volunteer fire departments.
You got it. Okay. Go ahead and call the roll.
Okay. District 1 Supervisor Buck Condit.
Aye.
District 2 Chairman of the Board Vito Chiesa.
No.
District 3 Supervisor Terry Withrow.
Aye.
District 4 Supervisor Manny Grewal.
Aye.
And District 5 Supervisor Chance Condit.
Aye.
Okay, motion passes 4/5, 4 out of 5. So can we take the rest of the items together, or does someone want to? I'm looking to see if anyone wants to pull any items. Everyone's okay? Okay. So there's 9 more recommendations minus item 2. Do I have a motion?
I move to approve the 9 recommendations.
A motion?
Second.
And a second. All those in favor say aye.
Aye. Aye.
Opposed? Motion carries 5-0. Thank you. Okay, so now we are on to the most important topic of the day. Item 10, a discussion item. It's an update on the well construction permits in Stanislaus County. And Raul Mendez, Tom Bose, and Patrick Kavanaugh will be presenting. And we do not have any public comment, written public comment. Is that correct? On this item, we don't have any written public comment.
Mic check. Oh, there we go. Thank you so much. Good evening, Chairman Chiesa, members of the board, CEO Hayes, County Council Bose, Raul Mendez, again, Assistant Executive Officer with the Chief Executive Office, here to introduce this item. Tonight, I will be joined by County Council Bose, Senior Management Consultant Patrick Kavanaugh, to provide an update on the Stanislaus County Well Construction Permit Program. A recent ruling and judgment by the California Supreme Court requires us to change the method in which our Department of Environmental Resources issues well construction permits. As such, your staff has determined it is appropriate for us to provide an update to the board and the public on this important item for our community. Mr. Bose and Mr. Kavanaugh will cover relevant background and history, explain the court ruling and judgment, and highlight some of the work done by our county staff in recent weeks on this item and what to expect, what you and the community can expect moving forward. Today is just an update to ensure everyone is aware of the imminent change in the program, and we plan to return in the near future with more specific changes to our well construction permitting process. At this point, I would turn it over to County Council Bose to start the presentation. Thank you.
Thank you, Raul. As my predecessor often said, it's not good when the attorney has to speak. So with that introduction, we've been admonished not to use acronyms without explaining them, and today I'll be using the acronym CEQA, C-E-Q-A. CEQA refers to the California Environmental Quality Act, and it's a statewide statute passed in 1970, signed by then Governor Ronald Reagan, and modeled after the National Environmental Policy Act. And it requires local public entities to consider the environmental consequences of their discretionary actions, and it's intended to inform decision makers and the public about the potential environmental effects of proposed activities and to prevent significant avoidable environmental damage. That is the law that is at issue with respect to the case that we're going to tell you about. It's an interesting area of law. It keeps lawyers employed full-time. In fact, in 2020, there were 36 cases reported, one from the California Supreme Court last year, and that's our case, 34 from the California Courts of Appeals. And you might think, only one case in the California Supreme Court, and that was ours. But that one case represents the lowest number of CEQA cases decided by the California Supreme Court in the last 15 years. So it's an active area of law, and hence why we find ourselves in this situation. Turning to our case, I'll start with a bit of background to put the issue in context. In the late 1960s, the State Department of Water Resources adopted water well construction standards. In 1973, the county adopted an ordinance which required a permit from the county health officer in order to construct a well and establish several standards for water well construction and imported standards adopted by the DWR. The county's longstanding practice has been to treat all non-variance well construction applications as ministerial and hence exempt from CEQA. In 1990, DWR, that's the Department of Water Resources, issued regulations known as Bulletin 7490, stating that the standards set forth in its previous bulletin and in this bulletin together are these minimum statewide standards. Those standards recognize that it is impractical to prepare site-specific standards covering every conceivable case across the state and provide for deviation from the statewide standards by local permitting authorities based on local geologic and hydrologic conditions. Section 8 of Bulletin 7490, titled Well Location with Respect to Contaminants and Pollutants, is the main point of contention here in our case. In 2014, remember that's many years after we started this practice, plaintiffs protecting our water and environmental resources sued the county, alleging that the county's policy of treating non-variance well construction permits as ministerial is illegal because these permits approval decisions are discretionary under CEQA and therefore not exempt from environmental review. A companion case titled Costin et al. Versus County of Stanislaus, where Costin alleged similar defects in the county's procedure. Can you hit the next slide for us? There's our timeline. It's important to note that the county strongly disagreed on this point with the plaintiffs, and in fact we were not alone. The Second District Court of Appeals held in another case, California Water Impact Network versus the County of San Luis Obispo, that a trial court's determination that San Luis Obispo's county's issuance of 4 well construction permits qualified as a ministerial action and therefore exempt from CEQA review. So we had some pretty good a place to argue, hey, our long-standing practice has been held as ministerial. In 2015, the Stanislaus County Superior Court found in favor of the county, holding that county staff exercises no discretion in issuing well construction permits and issued decisions in favor of the county in both the Power and the Costin case. Plaintiffs in both the Power and the Costin case appealed to the 5th District Court of Appeals, which is the Court of Appeal where our county sits. And in 2018, the 5th District issued a broad opinion that Section 8.A of the bulletin requires staff to determine whether a well was located an adequate distance from any source of potential contamination, and therefore required staff to exercise discretion for any permit application under the program. The problem was the word adequate distance. With 2 courts of appeal, the 2nd District and our 5th District issuing conflicting opinions on this subject, the county successfully petitioned the California Supreme Court to review the case. In August 2020, the Supreme Court issued a narrow ruling holding that the single well separation standard identified by the Court of Appeals does confer discretion, but that the county is only required to conduct environmental review for permits that trigger that standard. In other words, those that are sufficiently close to potential sources of contamination to require determination of whether the separation is quote-unquote adequate. The Supreme Court remanded the case to the Court of Appeals to answer outstanding questions. We can hit the next slide. On remand, the 5th District Court of Appeals interpreted the Supreme Court's decision as requiring environmental review where the well separation standards and at least 2 additional standards from the state bulletin apply. Specifically, the court concluded that in addition to Standard 8A, which we've already discussed, Standards 8B and 8C also confer discretion in at least some circumstances. So now we have 3 situations in which discretion by staff is applied. Section 8A of the bulletin, which addresses the distance between proposed wells and potential sources of contamination. Standard 8B, which provides that where possible, a well shall be located up the groundwater gradient from potential sources of pollution or contamination. And under 8C, if possible, a well should be located outside of areas of flooding. We're now at the last of our background slides, so you can hit that. The Court of Appeals then remanded the case to the Superior Court, our Superior Court, directing it to enter a judgment in favor of the plaintiffs that is consistent with their opinion and to declare unlawful the county's practice of treating all issuance of non-variance well permits as ministerial acts under CEQA. And the Superior Court has complied with that directive and issued its amended judgment on September 1st. As we indicated earlier, the county must now comply with the California Supreme Court and the 5th District Court of Appeals rulings and identify those permits where the 3 instances of discretion could be applied, determine if another exemption applies to CEQA, and if no other exemption applies, apply appropriate level of environmental review. Okay, I'll turn it back over to Patrick. Hopefully I didn't bore you too much with that in-depth review. On to Patrick.
All right, good evening. I'm going to provide some bit of information on the current status of well permit applications and then discuss a little bit about what our process is moving forward. As of close of business Monday, the Department of Environmental Resources, which is the department that is charged with the processing the well permit construction applications, had on hand 73 total well construction applications. Of this, 46 are classified as agricultural or irrigation wells, 20 are domestic private wells, and 7 are other type of wells. Each application, as Tom mentioned, requires evaluation as to the appropriate path to comply with CEQA. So currently, the Department of Environmental Resources is working with County Council with support from consultants JJ&A, Tri-Hydro, and Formation Environmental to update its well permitting and CEQA processes to ensure alignment with the judgment and to move permit applications through the process in an efficient manner. Criteria is being developed that may be used to determine if a proposed well is CEQA exempt, with the expectation that domestic wells, monitoring wells, and replacement wells will be exempt from environmental review under CEQA. CEQA reviews for the remaining wells will be focused and streamlined. So as Raul mentioned, that county staff will return to the Board of Supervisors in the near future in the next 1 to 2 months with some additional updates on the proposed path forward. And that's really it for the presentation this evening. We do have one staff recommendation. Our only recommendation this evening right now is to accept an update on the well construction permits in Stanislaus County. And with that, we're available for any questions.
Any questions of staff? Okay.
So thank you guys for your work, Tom and Patrick Rowell for all this. But I guess I'd like to see us go a little bit further rather than us just wait for another update from staff on this. I think as you look through this, you can see it's pretty, whatever, you can make the argument pretty well that the Supreme Court decision, the Court of Appeals decision, pretty much didn't confer discretion in all cases, right? They're just saying it's specifically, these wells that are close to a septic system, ones that are in a floodplain or downgrading from a contaminant source. That's specifically what both courts said. And when you combine the two they both didn't say that, but when you put the two, that's kind of what came out of that. So it's not really like that all well permits now should be subject to this. I think what I guess I'd really like to see if we could have staff go back with kind of a more definitive ministerial standard for not only the domestic, because we know the ones that are exempt, the domestic wells, the monitoring wells, or replacement wells, those for sure ministerial, considered ministerial still, and just will be. But I'd like us to go back and come up with language that specifically identifies the ones that would be considered discretionary, which are those ones that fall in those 3 categories from what we've been told by the courts. Near a septic system, downgraded from a contaminant source, or in a flood. Those are discretionary, and that all the other ones are not discretionary, are still ministerial, and that's following what the courts have told us. And so then that way we can focus staff can focus on those ones that are discretionary, that fall in those three categories. And if we could come up with language that says the other well permits are not discretionary, they're still ministerial because they're not in one of these three categories. And that would expedite, for the ones that are still sitting there in the queue that are there and any future application well permits. And I guess it'd be great if maybe a couple of us could be involved in the process so that when it comes back to the board again, we've kind of had our hand a little bit in this with you guys through this process to the extent we can. Anyway, that's my suggestion, if we could.
Do we have any, on our GIS system, do we have things that are down, or where contamination is? I know we have septic tanks. I think they've put it on the GIS system now, right, at DER? They've identified?
Outside of using plot cards, I'm not exactly sure what other information that's available.
But
on
how about contaminated areas? Have we started? Because that there lies a problem if we don't start identifying right away, that to get them to the ones that can be ministerial. Because in the end, the SGMA is going to determine where wells are going to be drilled in the future. And they're doing all this work. Todd Groundwater's in the Turlock Basin, they've done all this great work. And we're going to start duplicating some of this work. And not that we shouldn't. I'm not saying that, but in a month, 2 months passes and we come back and then we don't quite have it down in a couple of months. Well, all of a sudden we're in February or March and it becomes really problematic if we're still in a drought. So I don't, you guys have heard this before from us, but I think we should start identifying specifically what the Supreme Court and the Appeals Court have put their focus on, start identifying those spots in Stanislaus County.
Chairman Chiesa, that can certainly be part of the staff work that continues, kind of zeroing in on those specific elements of the court ruling. But again, it's just a matter, we need a little bit of time to kind of put that information together, but all great points. Staff would be more than happy to work with a committee if that's the desire of the board, but we'll leave that to your decision.
Okay. I did have one speaker card, but I know Lad's not here. Does anyone else want to come up and speak? Or you just came for the update? Yeah. Hopefully you got something good out of this because you stuck around the whole meeting. Same thing. Dan, do you have anything? No. Okay. Yeah, Lad tapped out a little while ago. I saw him head on out. Okay, so with that, I'll bring it back to the board. Any other comments, or we're just going to accept the report?
So are we going to get maybe a committee from the board?
Oh, yeah, that's right. Yeah.
If we could do that, that'd be great. I'd like to be a part of it. I don't know if you want to be a part of it. It'd be probably good.
Do we need to make a motion on that?
No, I think the chair can just appoint an ad hoc committee without a...
Just so, everyone okay with Terry and myself?
Yep.
Okay. Okay. All right. So a motion to accept and form an ad hoc, or I'll just...
Yeah, that's my motion.
Yeah, okay. Second. Thank you. We have a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Thank you very much, Patrick and Raul and Tom. I'm getting there. Okay, on to correspondence.
This board has received a copy of the 2021 Crows Landing Naval Base Easement Annual Monitoring Report from the West Stanislaus Resource Conservation District.
Referred to the Chief Executive Office and Environmental Resources.
This board has received claims for refund of property taxes filed on behalf of BNSF Railway Company regarding assessments for tax years 2017-2018 and 2018-2019.
Refer to County Council and Auditor Controller.
This board has received a letter from the Keys Community Services District regarding the appointment of Ronald Reforma to their board of directors.
Refer to the Clerk Recorder and Registrar of Voters.
This board has received the claims as noted on the agenda.
Acknowledge receipt of claims and refer to the Chief Executive Office. Is there any Board of Supervisor reports?
Sure. I was able to oversee the gubernatorial recall election, and I just want to give kudos to Donna Linder and her staff. They did a phenomenal job. It was a great experience, and just keep up the good work.
And thank you very much for serving. Appreciate it. Manny? Nothing? Okay, legislative fiscal management report.
Yes, thank you very much. Given the hour, I want to shorten this up a little bit. I just want to acknowledge that since we last met as a board, that the 2021 legislative session has ended in Sacramento, and there are numerous bills waiting on the governor's desk that do have impacts to Stanislaus County, so we're tracking those very, very carefully, and we'll keep you informed of their progress as the governor considers signing into law. I also want to acknowledge that we are off and running with our redistricting workshops throughout the community. I know some of you on the board have had an opportunity to attend workshops located in your respective districts. We do have informational flyers that were in the lobby there, so hopefully members of the public grab those today in English and Spanish available. So we just want to continue to reinforce that that is available. We also want to make the public aware of a newly added virtual meeting, which will be held on September 30th from 6 to 8 p.m. And you can go to stancounty.com/redistricting for more information on these workshops. If you're having any challenges with that technology, just call our office at 209-525-6333, and we'll help you through the process. And I also have just one other administrative task I need to take care of this evening. There is a, I believe, government code section that that essentially says when the Board of Supervisors takes action to appoint a department head, that we are to read the department head's benefits and salaries into the record. I want to acknowledge we've had a couple of appointments recently that are not Board of Supervisor appointments. However, we do think in transparency that we should just go ahead and do the same, even if it is a CEO appointment for those positions. So I would like to just inform the public that we have appointed our Community Services Agency Director, Amanda Sharp, to the position of Director of Community Services Agency. Salary is $195,000 per year and includes our department head benefits package. We have also appointed Robert Koslevy to the position of the Director of Environmental Resources at a salary of $160,000 per year, also receiving our department head benefits package. That concludes my report this evening.
And Robert, stay for the whole meeting. Welcome, for sure. Okay, and we have a meeting next Tuesday, 9 a.m. If there's nothing else for the good of the order, this meeting is adjourned.